checking how we're live.
Okay.
Take the bill over first, please. That sheet of paper. This one.
Okay. Yeah, I see. Oh, you're on live screen. Good afternoon. The Senate Finance Committee is now in session. Our bills today are going to be heard in the following order. Number 177, 215, 35, 211, 107, 95, 273, and 223. Now, remind everybody that following order, that following the lead sponsor, there will be, well, the sponsor will have as much time as the sponsor needs. That in each case, among the affirmative speakers, there is the first one who will have 5 minutes needed. All other witnesses will have 2.5 minutes. If there are questions, you'll be able to answer those if committee members have any. And so now we're going to get started with Senator Washington's bill, Senate Bill 177. Regulations, flavored tobacco products, prohibitions.
Yes, sorry. Thank you. Sorry. Thank you very much. Thank you, Senator. Thank you so much. It's good to see all of you here today. We're very familiar with this topic and the importance of addressing this issue that is affecting the health of our communities in Maryland. I first want to start out by, again, thanking you for this opportunity to speak with you about SB 177. But I'd like to just point out that we've submitted some technical and proactive amendments to the bill. So we did attempt to submit these amendments in November, and given the pandemic and the backlog, we just want you to know that we're not being disrespectful or last minute, but again, just knowing that we just got these amendments, and hopefully we understand that you're just seeing them for the first time, and I apologize for that. That being said, the substantive amendments include the following. There's a technical correction to the definition of electronic smoking device, also to flavored tobacco product and tobacco product, to ensure that these definitions are in line with current state and federal law. In addition to prohibiting the sale of these products, last year's bill did not include language on marketing the products. So we included language that would prohibit licensed retailers from marketing, displaying, or advertising these products. Now, given the separate and important issues of police reform, we have proactively submitted an amendment to ensure that no law enforcement officer may stop, question, search, or arrest any person on grounds of or in relation to possession, consumption, or purchase of any flavored tobacco product, or for the purpose of inquiring or determining how or from what person. Again, it's not the intent to increase opportunities for interaction with law enforcement. The goal of this bill is to improve the health of Marylanders. I want to tell you today that I am really honored to sponsor this legislation. It has the support of a large and diverse coalition of faith and community people. The coalition represents healthcare experts, faith leaders, as I said, parents, young people themselves, who all want us to help them remove this toxic product from their neighborhoods. Now, this bill is not going to solve everything. We know that individuals make choices. We know that individuals attempt to subvert the law. But what we can do as a state of Maryland is to save the state hundreds of millions of dollars in healthcare costs, and we can reduce the overall suffering and addiction that has plagued. And we want to eliminate it, but we can reduce it. This marketing of flavored tobacco products is actually a story of inequity and inequality, and it's not new. The COVID-19 pandemic has also brought forward a lot of these issues. Now, one such issue is the predatory and targeted efforts of big tobacco, who you'll hear from later, to hook and focus on low income and Black and brown communities, particularly our young people, and to hook them on flavored products. So why we need to do this now is that we can protect our citizens from this toxic product that actually contributes to 7,500 deaths in Maryland each year. I want to say that again, 7,500 deaths in Maryland each year, as well as 2.9 billion in related healthcare costs. So I'm asking you to support the legislation for this reason. The research draws on hundreds of tobacco industry documents. There's a pattern of highly targeting menthol cigarettes, which is why menthol is included in here, and that targeting is focused since the 60s on low-income African-American communities. Menthol is really easier to smoke because it's minty taste and it has this cooling sensation. So it's really smart marketing strategy. The darker, the more nicotine that's stored in your body, it makes it much easier to become addicted and much more difficult to quit. There is even some evidence that correlates skin color, the darker your skin, that is also this more likely that this particular type of nicotine can be stored in your body. So in 1952, only 5%. So talk about the impact of marketing and the impact of flavored cigarettes and how it's grown. Only 5% of Black Americans use menthol. Today, it's almost 85%, and 7 out of 10 youth smokers smoke menthol. Black men now face the highest rates of mortality due to tobacco-linked conditions such as lung cancer and heart disease. And in 2009, menthol cigarettes were exempted, right? They were exempted from flavored cigarettes. The federal government had outlawed flavored cigarettes, but in 2009, menthol cigarettes were exempted. So now we're in the 21st century, and big tobacco has been innovating. And we've seen the emergence of these e-cigarettes, which are most commonly used by young people. It has surpassed the conventional cigarette in 2014. So it's strongly associated with tobacco products among young people, and it's not just a way to stop smoking cigarettes. These young people are actually smoking cigarettes and doing e-cigarettes. And this should actually come to no surprise. There are only 15,000 flavors. Now these flavors are targeting young people. It's minty menthol, it's glazed donut for tobacco, gummy bear, and cotton candy. So clearly it's designed to hook kids into a life of addiction. These devices deliver massive doses of nicotine. And in fact, just one Juul pod contains as much nicotine as a pack of cigarettes. So currently it's staggering. Nearly 25% of high school students use e-cigarettes. That's a rate 5 times higher than adult use. 80% of our teens who have ever used tobacco started with a flavored product. So wouldn't it make sense that we'd want to try to get rid of this entry drug? Despite age restrictions, we do know kids are accessing these products. In my city, 87% of public schools are within 1,000 feet, about 2 blocks of a tobacco retailer. I'm really happy that we have the support of Baltimore City and a number of other organizations and groups for this legislation. If kids can't get the products from their local store, they might try to get it elsewhere. The reality is that big tobacco uses e-cigarettes as a path to addiction, and it's that minty taste. To add the insult to the injury, tobacco defends e-cigarettes, and that's what you're going to hear, by saying that it helps them kick the habit. But as I said earlier, they're not kicking the habit, it's giving an additional incentive to smoke even more. And the truth is that e-cigarettes are not a proven or approved CDC or FDA cessation product. So it's our job to protect Marylanders, especially our young people, especially our youth, from these toxic products that cause death and suffering in our communities. And we know if you care about addressing healthcare disparities among our low income, our African American, and all people of color, this will be a great beginning. Please, I also understand that we've asked one of the senators to submit an amendment to pull, has been asked, we didn't, to pull premium cigars and pipe tobacco products out, and so we can have that discussion. Our hard line is menthol, e-cigarettes, and vape shops. no exceptions. You'll hear from our panel, Madam Chairman. That ends my my introductory remarks, and I appreciate this opportunity allowing me to have that extended time to do that. You'll hear from our Attorney General, Brian Frosch, who you know has been a strong advocate for us in so many platforms. You'll also hear from Dr. Eden Neptune, Johns Hopkins University's Division of Pulmonary and Critical Care, who will speak to the health crisis that is e-cigarettes and vaping. And you'll also hear from Reverend Al Hathaway, Union Baptist Church, also we know a fine advocate on so many platforms. Thank you very much. And again, I ask for your support of this important legislation.
Thank you. Members, are there any questions? Well, I think the sponsor did a. Yeah. All right, Senator Feldman.
Yes.
Thank you, Madam Chair. So, Mary, just you know, since it's your bill, I'm not a little. You referenced the issue of premium cigars, but you said let's have that discussion. I mean, do you have because you talk about e-cigarettes and you know all the other things. So, do you have a position on the premium cigar amendment that's been offered? And I guess the broader question of cigars versus kind of the, you know, the gist of the bill is directed at the e-cigarettes and flavored. I mean, just to put that out there before we move on to Attorney General Frosch.
Sure.
Kind of skipped over it. So I just want to press you a little bit on that one.
Yeah. My position has been to submit the bill as clean. And also, but willing to understand having a conversation about focusing on youth and focusing on the most toxic elements. I'm just expressing a willingness to have that. So given our Zoom platform and us not being able to sort of have some of the dialogue that we might otherwise have in these kind of smaller groups, and that I'm not a member of your committee, the advocates wanted me to be able to express that to you.
Okay, fair enough, Madam Chair. Thank you.
Okay, Senator Hershey has a question.
Thank you, Madam Chair. Senator, couple questions. You continue to mention teens, young people, youths, but didn't we just pass legislation prohibiting the sale of these products to these same under 21 adults that you're speaking about?
Yeah, and thank you for that question, Senator. As I said in my remarks, there comes a time when simply banning does not provide the behavioral change that we need. And it's our position that we just simply need to take this off the market. When we find that things are so toxic, and yet they are still being made available through all kinds of means, that it's our responsibility as legislators to simply remove that from the market. We should not be selling it.
So if the bill then really doesn't do exactly what you've been saying, because like I said, your argument has been before about these younger people being able to make decisions, that the bill really is about adults, right? And whether or not they are capable of making the decision to buy these products or not. And what you're saying is that they're not capable of those decisions, and that in fact that you have to ban the product to prevent them from making an adult decision. Is that right?
No, that I wouldn't express it that way. What I would say is that these adults become addicted as children.
Right, and that's why we passed Tobacco 21 a couple of years ago to try to stop them from using these products as adults. That was the whole purpose of Tobacco 21, is that they were getting hooked on earlier. And I agree with it. I mean, you know, they're getting hooked on earlier. We made that decision to pass it, but now we're still saying that these adults still can't make up their mind and it needs to be completely banned.
Again, when we have a responsibility as legislators to protect not only the global health of Marylanders, but also looking at the economic costs of these choices. And so, you know, someone could choose to drive around with faulty brakes or no brakes. They could choose to drive without a license. Anyone could make a number of decisions, but we do set limits on what adults are able to do. Rhetorically, I focused on youth and young people because, again, it's just such, they know that if I'm going to have this person from 25 for the rest of their life, I got to get them at 10 and 11 and 12. And gummy bear and cotton candy is a way for me to have a customer for life. And so what we're saying is, no, we're going to cut that off right from the beginning, because it just simply is not in the interest of Marylanders, and specifically because of this focused targeting of low income and minority communities.
Okay, well, again, you use the same argument, so I'm not going to continue to labor over this. But again, you keep going back to making decisions for those that are younger. And again, we've passed legislation to do that. I thought that was something that we as legislators thought was a good idea. You're now saying that it was, in a sense, worthless to do that because, it's completely ineffective, and now we have to completely ban the product. And that's what I have. Obviously, my concerns about this is you're using an argument about young people, but yet the ban is for adults, and you're saying that adults cannot make the appropriate decisions.
Yeah.
If enforcement issue that's out there, I mean, then maybe that needs to be addressed. But an overall ban and taking away the ability for adults to make decisions on what they want to do, again, it's just a slippery slope. Next thing we'll be talking about, other types of tobacco products. We might be talking about, alcohol at some point in time. Maybe we start talking about sugars and drinks and all those types of things. We're getting down that slippery slope of saying, you adults, you individuals don't know how to make your own decisions, and therefore we're going to regulate it for you. So that's my concern with it. Appreciate your intents. Just wish that the conversation and the ability to talk about this bill focused on what it really is and not necessarily what we've already legislated. So thank you.
Okay, we're going to Senator Battle next for her question, but I thought, Senator Hershey, that I did hear her tell us about the impact fiscally on the state of Maryland, which means all of the ratepayers, given her analysis of the status quo.
Madam Chair, I understand that, and there's lots of decisions that we can start making for responsible adults and start making their decisions for them if the overall goal is that we're going to save healthcare dollars down the road. I mean, maybe we should be talking about that because there's a lot of things that we should be doing, but I'm not sure that we as a state want to start regulating each of these decisions.
Okay, Senator Battle.
Thank you, Madam Chair. I looked at the fiscal note, and it just talks about the loss in revenues, 11.8 million this year, 69.4 million next year. But the Maryland Center on Economic Policy talks about the benefit, and obviously to healthcare, and significantly like $41 million benefit to us from healthcare. So would the sponsor like to address that at all?
Absolutely. Thank you for that opportunity, Senator Bidle. We spend nearly 2.9 billion each year in healthcare costs. And should the body decide to override the governor's veto, we still would ultimately result in 41 million in revenue to the state. So it's not the case that we would. So if I'm looking at spending 2.9 billion a year and 41, that we could save that so much that we could focus on COVID response, any number of things. And also, Senator, we would save lives. So thank you for that opportunity. We'd save money, but we also save lives, and we save adult lives.
Thank you.
Thank you. All right, we're going now to our second witness. And although we said everybody else would get 2.5 minutes, because this witness has so much legal expertise, we want to hear from the Attorney General, Brian Frosh, and to go over what is legally permissible and what we can do to get around any landmines should the committee decide to pass the bill.
Well, thank you very much, Madam Chair. It's a pleasure to see you, even if it's virtual. And I'm pleased to be here to support Senator Washington's bill. I'm also honored to be on the same panel with such distinguished people as Reverend Dr. Hathaway and Dr. Neptune. And I endorse really everything that Senator Washington said. And just to address the issue of youth vaping, the consequences of allowing our children to become addicted to nicotine, which is what the vape products are are devastating. I mean, we've seen stories, and I'm assuming Dr. Neptune will go into this in greater detail, but we've seen stories of kids and young adults in the hospital suffering from lung illnesses, breathing difficulties, on ventilators. Some of them had lung transplants, and it's all because of vaping. We're in the middle of a pandemic from COVID-19, but we have for a much longer period been in the middle of an epidemic related to vaping. And as Senator Washington said, more than a quarter of the high school students in our state are using e-cigarettes. Last session, before things got shut down, I spoke to a group of about 20 to 25 pages. They were working in the House and in the Senate. And I asked them, is there vaping going on in your high school? Every single hand went up. These kids, as you know, are from every county in the state. They're in different schools. There's vaping in every single one of them. I asked them how bad it is. They said it's pervasive. They said that it's going on in middle schools, that it's pervasive in middle schools. And why are they vaping? The answer is really very simple. It's because the companies are targeting children. The advertising campaigns of these folks are not targeted at adults. They're going after kids. And I'm not sure, am I able to share my screen here?
I wish you could, but you could send us back any additional information or graphics that
Sure.
before we vote.
If you, and my office can send you the slides, we'll send you the pictures of the advertisements. They've got glamorous looking young people advertising vaping. They got pictures of gummy bears. They've got pictures of essentially apple juice flavored vape product. It's like they stole the copyright from Mott's apple juice. And they've got fruits and candies, and the flavors are not flavors that adults start out looking for. It may be that after they become addicted as kids and go on as adults to continue to smoke gummy bear or some other strawberry, raspberry type of flavor. But when asked by the National Institute of Drug Abuse why they vape, 42% of the surveyed teens said because it tastes good. We think this legislation will go a long way toward reducing access to these harmful tobacco products. And to Senator Hershey's point, that's right, it is illegal for these kids to get these products and to inhale them. But the fact is they're getting them. And I don't know whether it's because there are shops that are selling them to kids, whether adults are buying them and giving it to kids. I mean, you know, we were all teenagers once, and I'm pretty sure that before it was legal, I remember having a few sips of beer now and then. But that's not nearly as addictive as these pure nicotine vaping products. And we're putting our kids' lives on the line when we continue to allow them to be sold at every retail location that is licensed to do it. The target of the companies is children, and it needs to stop. Thank you.
Thank you. Are there any questions? Senator Hershey.
Thank you, Madam Chair. Thank you, Attorney General Frost, for your comments. Good to see you again.
Nice to see you too, man.
Just one of the things I thought we decided in the Tobacco 21 legislation was to not make criminals out of the youths that may use these products, right? We only said we're not going to sell it to them, but we really didn't make it illegal for them to use it. Is that accurate?
I think you're right. I think it's a crime or a violation for a store to sell it to somebody under 21.
Right. So if we're really trying to stop those under 21 from doing it, why wouldn't we want to make it illegal? I mean, in a sense, possession of alcohol for somebody under 21 is considered illegal. But why didn't we do that with the legislation last 2 years ago and actually make it illegal for youth to have these products and possess these products? And maybe that would change some of the stories you heard, because maybe the youth just don't think it's illegal to have. Maybe they just think that they're not allowed to buy it, but they can still possess it. Isn't that a flaw in the law that we passed before?
Well, I don't think so. I mean, you're looking at the problem through a law enforcement lens. Can we penalize people hard enough or efficiently enough so that they won't go after and become addicted to these products? And I think you need to look at it through a public health lens. And the public health experts tell us that this stuff is extremely harmful and extremely addictive. And we need to keep kids from starting. And the question really is, how useful is it? How important is it to have gummy bear flavored vape product or strawberry flavored or candy cane flavored or whatever vape products? Why is that important to the public at large? And I don't think that its utility is so great that we can afford to risk the lives of our children. And so I think this approach is one that is much more likely to succeed than one where, you know, you're locking kids up or fining them or whatever if they get caught with the product. If you get addicted to this stuff and it doesn't take very long, the fact that you might be subject to a fine, we see this with heroin, we see it with cocaine, you know, the fact that you can get punished for it doesn't deter people once they're addicted. And so I think it's better to say, look, we really don't need cotton candy vape products.
So I appreciate that. If I can just follow up on that, because you brought into other illegal substances. Obviously, we still have problems with illegal substances being on the streets. Does a legislation like this, in a sense, build a black market for these types of products? Again, we're not making it illegal for somebody to possess or use them. We're really only, in a sense, you know, if you look at the law itself, hurting those that sell the products, okay? The products can still be on the street, they can still be used, but they can now, if this law passes, be done through a black market. So what happens there? Is there any evidence on what that looks like? Is it comparable to the drug market of illegal substances? Are we going to see something like that with these types of products?
Well, I think there would certainly be some sort of black market. People would attempt it because it's lucrative. You can tell that right now. We got a quarter of the high school kids in the state of Maryland who are already vaping. It's probably similar in middle school. So there are a lot of folks buying it. So somebody who is unafraid of breaking the law or unafraid of the consequences would probably try to sell it on a black market. That's an easier law enforcement problem to solve than trying to go after every child who is vaping. And I'm not saying, you know, we're going to stamp it out entirely. Our neighboring states may still allow these kind of flavored vape products, but it pushes it back.
Mr. Attorney General, I'm sorry, I should have been more specific. I'm looking at a black market more in the potentially the menthol cigarette market is what we keep hearing about. How that could kind of surface its head as opposed to, you know, a black market and trying to get high school students, flavored vape products. I mean, can you talk on that
Well,
specifically?
if I could, if you don't mind, one of the
Sure.
things, Senator Hershey, that they won't have is the massive marketing and millions and millions and billions of dollars to target these young people. So that will not be a part of that marketing. I just wanted to thank you.
The marketing, the national marketing could still go on. I mean, you're not going to control what's on Maryland, television networks and things of that nature. I mean, I don't think that this puts national marketing plans out of business because, they can
don't have signs and
still targeting Washington, D.C. and Virginia and surrounding states, correct?
You're not allowed to advertise tobacco on television, so the marketing plan wouldn't be on TV anyway.
Anyways, right.
But yes, I mean, there would be less marketing to children and to people who are smoking menthol cigarettes. But some would probably
through the internet. Could you control marketing through an internet?
You probably can't, but unless the advertiser knows that it's going to an individual in Maryland. So you're not going to stamp it out entirely, but you're going to make a huge dent in it.
Okay.
Thank you, Madam Chair.
So we've had quite a colloquy on that. And I think the whole point seems to be to protect the public health of our kids. And we do a lot of things in order to protect their health. Okay, we're going next to Enid Neptune.
Hi, well, thank you for inviting me. My name is Enid Neptune.
You have 2.5 minutes.
Yeah, I'll try to rush through this, and I'm certain there'll be a number of questions. I thank you for the opportunity to speak on behalf of the American Thoracic Society, having served as a recent vice chair of our Tobacco Action Committee. I am a lung specialist and a researcher at Johns Hopkins, and a large proportion of the patients I see in clinic suffer from cigarette smoking related lung disease. And this includes COPD, emphysema, and even lung cancer. I understand both the biology of cigarette smoke induced injury and the clinical consequences of tobacco exposure, which allows me to speak on the merits of this legislation. First, I would like to state that the debate on flavored tobacco products is over. They cause harm to our young people, our communities of color, and to our economy. They have no role in smoking cessation. They provide no benefit from a public health or a clinical posture. When I care for COPD patients who require supplemental oxygen to breathe and are unable to have the retirement experience that they merit because of their decades in the workforce, I hearken back to their initial experiences with tobacco. They invariably recount initiation at the ages of 10, 12, 14, or even their late teens. As several speakers have mentioned, the initiation of tobacco use is intimately tied to the availability of flavored tobacco products. As many have quipped in the tobacco control community, a spoonful of sugar helps the nicotine go down. So what is the clinical data? The US Surgeon General has concluded that youth use of tobacco in any form, including e-cigarettes, causes addiction and can harm adolescent brain development, impacting attention, memory, impulse control, mood, and learning. And a recent Stanford University School of Medicine study found that young people who vape were 5 to 7 times more likely to be infected by COVID-19 than those who did not use e-cigarettes. A few years ago, the tobacco product manufacturers would argue that the use of non-combustible tobacco products could serve as harm reducers if they replaced or prevented the initiation of conventional cigarettes. We now know that this is not true. E-cigarettes, as others have said, are extremely popular with youth and young adults and are often used in combination with combustible cigarettes. I'm not going to discuss the economic impact, which was so kind of detailed, presented in such detail.
If I could butt in, Doctor, you actually are over, but we need the medical information. So
Well, I'm almost done.
economics, but go ahead a minute.
Yeah, and it's not just kids. As an African-American woman, the issue of menthol additives is particularly offensive. Menthol is not just a flavoring, it's also a drug that acts on lung cells to reduce the irritative effects of smoking. This menthol drug increases the addictiveness of nicotine and reduces a smoker's ability to stop smoking. Since the 60s, tobacco companies have targeted the Black community with these products, leading to a devastating and unequal burden of death and disease. Black men are more likely to be diagnosed and die of lung cancer than any other demographic group in Maryland, and suffer heart disease at a rate 56% higher than white Marylanders. Regulating menthol is not just a public health issue, it is also a social justice issue. The American Thoracic Society appreciates the legislators who support this bill and asks for the adoption of this bill in an effort to save the lives of Marylanders. Now, I wanted to speak specifically on the issue that was brought up by Senator Hershey, in that why the Tobacco 21 was not sufficient to address this issue. I think it's been recognized by all the states that have published, that have passed Tobacco 21 legislation, that this bill would be necessary but not sufficient to address the youth uptake of tobacco products. And in fact, the states that were the earliest in adopting Tobacco 21 legislation, and this includes Massachusetts as well as California, have seen that legislation as being part of a suite of legislative efforts that would be needed to address this emerging and incredibly devastating issue. And it's also been seen that the Tobacco 21 legislation would have to be employed in an iterative fashion, which means as we learn more, we will do more. And that's what this particular legislation reflects, what we've learned since Tobacco 21 was put into place. But I also want to address the issue of the Black market. And that is because we do have data from the earliest jurisdictions. Unfortunately, that's outside the US, actually in Ontario, Canada, that implemented kind of menthol bans and then subsequently implemented flavor bans. What they found is not only is the use of these products down in the populations who use them, but actually the ability to quit smoking in these populations that use menthol cigarettes has also gone up. So we are not only reducing the use of these flavored products, we're enabling people to quit using tobacco products altogether, which is the ultimate goal of this legislation. And so I will stop there and I will invite any questions about studies, about impact, et cetera.
And we probably may have some questions, but because I let you go a little bit over, I'll invite our members to, we have your written testimony too, I'm sure, or you can send it to us, to stay in touch with you before we vote, because we got lots of people and lots of other bills this afternoon.
Okay.
All right. Now, is there any critical question before I move on to the next witness? Okay, thank you. We're going next to Reverend Alvin Hathaway. And I must say, I'm going to listen very carefully because he is my minister.
Madam Chairperson and members of this honorable committee, it's a pleasure to speak to you. It's interesting that I support this legislation because I remember a 12-year-old Boy Scout who was influenced because he wanted to be cool and purchased a pack of cool cigarettes, got an adult to get them for him. They had a menthol flavor. They weren't as bad as the Camel cigarettes that didn't have that additive to it. And went one evening with his scouts on an overnight trip, and they got in the tent and began to pass those cigarettes out. And they lit them up, and they were sitting in the tent smoking and coughing. The scoutmaster came in and opened the tent door and looked and said, "What's going on?" Of course, he knew what was going on. It was smoke that just came right out of the tent. And then he said something that was so important. It was an intervention that I'm so thankful for. I was that 12-year-old. He said, if you like these cigarettes so much, you need to eat them. And that one intervention kept that 12-year-old from moving down a pathway that, one, saved money, one, had positive health consequences. Because of that one incident, that 12-year-old, myself, never smoked again. Because of that, I watched some of my other colleagues that were in that tent with me. They go on. One gentleman I remember so well, Ernest. He was now an adult. He died of throat cancer, and I had to officiate his service. And I thought about it. If he had listened, if someone had intervened for him, would he have not gone down that path? I see young people in my neighborhoods and community going into gas stations, and they go and they ask for flavors, not knowing that they're cigarettes. They want a flavor. And I say to them that they need someone to intervene for them, just like that Scoutmaster intervened for me 50 years ago. And I believe we have an opportunity to intervene on behalf of young people to prevent them from having the horrors as adults of health outcomes that are poor, of economic consequences where they spend their money because they are addicted to a substance. And I think, and I'm supportive of this legislation because I need you as the state of Maryland to intervene on behalf of those right now, as that gentleman intervened on my behalf 50 years ago.
Thank you very much. Are there any questions? Okay, we're going next to Willie Flowers.
Good afternoon, Madam Chair, members of the committee. I'm Willie Flowers with the NAACP of Maryland. I want to share a story just like the pastor did. My first anti-smoking campaign that I was introduced to was authored by the American Cancer Society when they did the Dragon Lady PSA that included Robin Givens. It was a breath of fresh air in a smoke-filled room. She was a young, cute girl moving around an arcade room, smoking and wreaking havoc because of the smoke. The visual hit home for me at the time because of who she, because of this beautiful young lady, but also it was kind of embraced what was going on with me at the time with arcades and that kind of deal. So American Cancer did a good job at making me understand the benefit of smoking, how it could disrupt something good in your life. It was not until I was in high school at the end of the 1980s when I really gained information about health horrors of tobacco. Both smoking cigarettes and smokeless tobacco were reduced to death wishes in my research for a high school speech class. It enriched the knowledge that I had about tobacco and how it can turn your body into basically death. If cigarettes were cancer sticks, then smokeless tobacco was like putting cancer into your mouth. That was skull and tobacco or snuff and this kind of thing. But the ultimate piece was all of these pieces added energy to me to be more mindful of my life and to also look around me because I had family members who smoked. Every one of my uncles who died, and I have at least 6 uncles who have died, all smoked either Cools or I think Salem Lights or whatever the choice was, but they all died early of cancer and preventable diseases. So I've somewhat dedicated my life to focusing on advocacy to stop smoking and to encourage people toward healthier options about their lifestyle. And so when this opportunity came along, I jumped at it. It was consistent with everything I've done in my life. That included doing the first smoking ban on our campus when I was in college at Troy University in Alabama. I did a Smoking Stop Here campaign here in the state of Maryland. And this is a continuation of that. And as a branch president in Howard County and the state conference president and of the NAACP here, I want to contribute that energy to this focus. And we support.
I hate to butt in, but your time is up.
I'm sorry. Thank you, ma'am.
Okay. Senator Klossmauer here has a question.
Thank you, Madam Chair. I just have a question for Senator Washington. Is smokeless tobacco in this bill too?
I think I don't believe so. And again,
Okay. I thought you would know off the top of your head. Okay.
Yeah, so well, I will tell you is that our amendments that we just got our amendments, so I don't want to tell you, but
Okay, that's fine. We'll figure it out. Okay, thank you.
That's a good point.
Thank
That's
you.
the first flavored
All right.
tobacco.
Okay, we're going next to a couple of favorables with amendments, and then we've got some unfavorables. So let's go to Matthew Bowley.
Good afternoon, Madam Chair, Mr. Vice Chair, and members of the committee. My name is Matthew Bowley of Rifkin Weiner Livingston, here on behalf of the Premium Cigar Retailers of Maryland, asking for this bill to be adopted as favorable with amendment. A narrow amendment that we propose, which would remove premium cigars and pipe tobacco from this bill. And I appreciate the sponsor's willingness to work with us on this legislation. The committee heard this legislation last year, and our position has not changed, and the facts have not changed. Premium cigars and pipe tobacco are not a part of the problem that this legislation seeks to solve. You did not hear today in the Attorney General's testimony that premium cigars and pipe tobacco are the problem that proponents and advocates wish to solve with this legislation, yet premium cigars and pipe tobacco are included in the bill. Premium cigars and pipe tobacco are specifically defined in the Maryland Code already. Premium cigars are 100% tobacco, hand-rolled. These are a premium product for adults. They cost an average of $8 a cigar. These are not products that our youth use. According to a joint path study conducted by the NIH and the FDA, the average age a person first smokes a premium cigar is 30 years old. Additionally, we have not anecdotally heard that these products are present in our schools. As a result, I suggest to the committee that the inclusion of premium cigars and pipe tobacco does not aid the proponents in achieving the goals of this legislation, according to what we have heard from the advocates today. Further, there's very problematic language on pages 12 and 13 regarding premium cigars and pipe tobacco. The language says that if a public statement is made that these products have flavor, it is considered flavored and therefore illegal under this bill. If a salesperson, a reviewer, a wholesaler, or otherwise makes a statement that this product has a hint of almond or a note of walnut, that statement would put these mom and pop stores at risk of having bought a product, paid the wholesale tax to the comptroller up front, and then have someone else, whether in a product review or some other forum, describe this product as flavored. It would immediately make the product that they legally purchased and paid tax on illegal. Not removing these products from the bill would place these stores at risk, that their product at any time without their knowledge could be deemed illegal by a third-party public statement. With that, Madam Chair and committee, for these reasons, we respectfully ask that the committee amend premium cigars and pipe tobacco out of this bill.
Thank you. Are there any questions? Okay, we're going next to Stephen Castro.
Madam Chair, members of the committee, my name is Steve Castro. I'm a graduate of the United States Naval Academy. I'm a combat veteran, and I'm co-owner of Davida Cigars. My brother and I started Davida Cigars in 1996 and have worked very hard to build our company. We started with one store and one employee and have grown to 12 stores and over 65 employees throughout the state of Maryland, only in the state of Maryland. We have taken many risks to build our small company. Our employees count on us to get paychecks every 2 weeks. We offer health insurance to our full-time employees at no cost, and we contribute to an employee retirement fund every year. We're a company with a good and honest reputation, and we pay our bills on time and our taxes. We take care of our employees, and we provide the products our adult customers want, premium cigars and pipe tobacco. Much like coffee or fine wine and spirits, premium cigars and pipe tobacco are luxury products. It's a product described with tasting notes like hints of fruit and nuts. Most importantly, we do not have a youth access issue. The FDA and the National Institute of Health have determined that the average premium cigar enthusiast, their first cigar is at age 30. The average price of a premium cigar sold in my store is $8. High school students are not spending that kind of money on one cigar. There is no teenage premium cigar and pipe tobacco smoking epidemic. If this bill goes into effect, it will force my adult customers to go to border states like Pennsylvania, Virginia, West Virginia, Delaware, DC, which is less than a 40-minute drive anywhere in the state. These bordering states don't have restrictions that are in this bill. On behalf of the over 30 premium cigar retail stores throughout the state of Maryland, I'm here to tell you if this bill goes into effect, it will badly hurt our small businesses and eliminate over 70% of the products in our stores. Products we have already paid tobacco tax on even before we've sold the product. This bill in its current form will hurt a lot of people. I want to thank Senator Washington for your willingness to work with us, and I urge the rest of the committee to please amend premium cigars and pipe tobacco out of Senate Bill 177. Thank you for your time today.
Thank you. All right, next we're going to the first of four, I think, unfavorables. We'll start with Neil Franklin.
Good afternoon, Madam Chair and members of the committee. Thank you so much for this opportunity to testify, and I really appreciate the noble effort here to address the health implications of tobacco smoking and vaping. I believe I'm the only policing expert so far that I can see on this panel. And just so folks know, I've got over 3 decades of policing in the state of Maryland, the Maryland State Police, Baltimore City, Maryland Transit. I'm a certified expert in criminal narcotics investigation, police practices, and policy and procedure and police training. And today I'm also representing the Law Enforcement Action Partnership, which are thousands of criminal justice professionals across the country who are working to improve public safety in our country here. So we totally understand and get the health consequences, as everyone on this call does. I mean, we get that, we completely understand it. So I'm going to address this from a public safety perspective and a little bit of public health as well. And I must say that we are not on board with yet another piece of policy, public policy, with a noble attempt to address an important public health issue, but we're using, in a sense, criminal justice strategies, which are unintended consequences. There will be a robust illicit market, mainly in Black communities. We heard that 85% of adult smokers prefer and use and do not intend to give up their menthol cigarettes. I've been out in the community, I've asked and spoken to many of them. They know that they will be able to get them through an illicit market, through a smuggling market. And yes, we're not going to go after those who are using. That's a smart move. It would be disastrous, but we will have to go after the smuggling market. We will have to go after the illicit corner markets. And we know that these markets from other forms of prohibition, such as drugs, the number one employee in these markets are kids. And now what we're doing is taking menthol cigarettes out of a current regulated market. We're not going to get rid of it. We're just going to move it into a very profitable illicit market, which is going to be very damaging to our communities. And let me wrap up with saying this. I've been in policing for over 3 decades. And when you give the police the charge of going after people who are smuggling cigarettes into our communities, into Baltimore City, into Prince George's County, into our small communities in Salisbury, Maryland, let me tell you, we're very creative in how we identify the people smuggling cigarettes. Yes, I can't go after you for having that menthol cigarette, but when I see you crossing the block in the middle of the street, or if I want to pull you up for some disorderly conduct so that I can find out where you're getting your menthol cigarettes from, as I pull up some kid on a corner who's selling Lucy's or whatever, and I'm pressuring them, I'll charge you with this. I can't go after you for cigarettes, but I'll charge you with this, or I'll let you go if you tell me where you're getting your cigarettes from. Here's my point.
That's your time limit. I'm so sorry.
Okay, I'll wrap up. Black law enforcement mainly is not for this, and I get it. And when you move this into an illicit market, it does become a very unhealthy product because, as with other drugs and as with alcohol back in the 20s, we saw the health implications there. So thank you very much. We just asked for an unfavorable report. Thank you, Madam Chair.
I have one question.
Yes.
I'm sure as a law enforcement officer, you're charged with getting illicit guns off the street, right? And when you are, there are some people who make a business for people who can't get a legal one with a regular license and behave themselves. Wouldn't you say this is in the same category when we are hurting public health and especially the health of our kids, and some of them are going to die prematurely because, and in some cases, face law enforcement for misbehaving if this is the law, unless you in fact do intervene. So what's the difference in your needing to have us not say that illegal guns are legal, because otherwise I got to go to work and divert them from the illegal stream?
Madam Chair, that's a great question. And after 3 decades in policing, especially when I was in policing, working undercover when our neighborhoods began to be flooded with guns. And the reason that occurred was because people needed guns to protect their drug markets. That's the main reason we had these flood of guns coming into our communities. And now they're here and they use them for just about any and everything and solving little disputes and so on. We're creating yet another competitive, profitable, illicit market in our neighborhoods, which will increase the need for these young people, unfortunately, to believe that they need guns to protect themselves and their corners and their market share. I'm telling you, at a time when we're turning the corner on marijuana, we're now going to open up the doors for another popular, consumable product to come into our neighborhoods in an illicit form, a very competitive form. And with that comes the violence and again, our kids being recruited into these businesses. We already have seen the growth of illicit markets in cities like New York just because of tax imbalance. When you completely eliminate a very popular and old product like menthol cigarettes in the Black community, I know from experience what's going to happen. And I know it's not intended, it's completely unintended, but no one across this country has been reaching out to law enforcement to have this discussion about what happens when we start to ban, to prohibit menthol cigarettes from being sold.
Is that happening right now without the ban, that people are doing all these illegal maneuvers in order to get the kids hooked?
Well, the thing is, when you have kids brought into the illicit market to sell, whether it's tobacco, whether it's other drugs or whatever, now you've actually introduced that product into that youth marketplace, into that peer network of young people, because there are no regulations, there are no controls. You're turning all regulations and controls over to the illicit market. So it's whatever they decide to be. That's what happens. And we're currently monitoring. It's still fresh in states like Massachusetts where they had.
Well, you're answering more than I asked you. I'm just trying to find out, with your police background, right now, without this bill, would you say that many people are really prostituting in a way off our kids? They know it's harmful. They are using the kids as the major pipeline to something that is going to reduce their lifespan and the quality of their lives and their ability to live productively, would you say?
Well, I would say there's history to that, yes. With just about most of the products that are out there.
You answered my question. Yes. Thank you. Mm-hmm. Okay. All right, Senator Reedy.
Thank you. Thank you, Madam Chair. Major Franklin, I know I'm on a new committee now. I've seen you before in a different committee, and it's always good to talk with you and get your perspective. I guess my question, I hear in your voice and in your testimony, your passion for wanting to show the unintended consequences of prohibition, which is really what we're talking about. You know, I was curious if you had thoughts about, in lieu of a ban, which you've pointed out the unintended consequences very well, what do you see as the reason that young people are getting hooked on these things? And then number two, what would be a more effective way of counteracting that? Or perhaps what would be a way that does not have the same level of unintended consequence of getting law enforcement to be stuck in the middle, enforcing like what we saw in New York with the loosies. I mean, it seemed absurd that there's a police officer trying to arrest somebody for selling loose cigarettes, but once you put that, once the law's that way, you have to enforce it.
Yeah, so I think we've already heard a little bit about what truly works and what is effective, and it is education. It is my dear friend Dr. Hathaway talked about that influence that he experienced, and I similar. That's the reason I've never smoked cigarettes, and many young people don't. When you look at the smoking, the decrease in smoking in this country among all age groups, it's because of education. It's because of influence. It's because of social pressure, where we don't completely ban something or restrict something from someone, but we make it difficult for them to use it in public places and restaurants and so on. And that's why we have been, as a nation, experiencing a drop in tobacco consumption. And I think we need to step that up. We need to figure out more ways to influence our young people and to encourage them not to, make it toward their benefit and show that to them. We've already proven that that works. We know that works. And again, we've heard from a couple people today on this call, of their experience regarding that. And that's where I think we need to be, not to unintentionally create something that can be very problematic, especially like in Baltimore, where we're just on the heels of this Department of Justice investigation for unconstitutional policing. And that wasn't, intentional, but when you give cops these missions, they feel that they have to go out here and they think they're making a difference. And many times they're actually arming communities.
Thank you for
Okay.
Thank you, Andrew.
Thank you. Before we move on, I just want to remind us all, including myself, that we've got 7 more bills and then we've got a voting session tonight. So, okay. Let's go next to Thomas Briant. Mr. Briant on? If not, then we'll go to Regina Clay. Oh, is he here?
Yeah, I'm here, ma'am.
Okay, Ms. Clay.
Good afternoon, Madam Chair, Mr. Vice Chair, and all the Senate Finance Committee members. First of all, I want to say that I absolutely appreciate Senator Washington's efforts of the reduced use of tobacco. You have heard the stories. I have a story too around tobacco use, but I'm here not on the health perspective, but basically unfavorably in the support of what the major just talked about in terms of policing, in terms of the illegal activity, especially affecting the communities of color. So that is my perspective. You do have my written testimony. I'm not going to take up your time. I've worked in Annapolis. I know what the day is like. So I'm going to let you carry on, Madam Chair, and you all can read my testimony for any further questions.
Thank you very much.
Thomas Bryant is here.
Okay, all right, Mr. Thomas Briant, I understand is here. If you're available, unmute yourself and proceed.
Thank you, Madam Chair and committee members. My name is Thomas Bryant, and I am the Executive Director and Legal Counsel for the National Association of Tobacco Outlets, which has retail store members in Maryland. Senate Bill 177 will be devastating to retailers because the convenience store business model relies on gas sold outside at the pumps and cigarette and tobacco products sold inside the store. In fact, cigarettes and tobacco account for 36% of these in-store sales. For tobacco specialty stores, 90% or more of sales are tobacco products. The retail impact would be so severe because the bill would ban hundreds of brands of menthol cigarettes, cigars, smokeless tobacco, pipe tobacco, and electronic cigarettes. In addition, retailers have already incurred substantial sales declines with business shutdowns and people working from home due to COVID. Enacting a flavor ban at this time means the retail business model would no longer be viable, leading to employees being laid off and stores closing. The impact to Maryland can be best demonstrated by examining what happened after a statewide flavored tobacco ban was enacted in Massachusetts last year. From June through November of 2020, Massachusetts lost $62 million in cigarette tax revenue and an additional $7 million in flavored tobacco product tax revenue. That is almost $12 million per month in lost excise tax revenue and does not include lost sales tax revenue. The underlying reason for the Massachusetts tax revenue decline is due to adults traveling to neighboring states to buy cigarettes and tobacco products. Connecticut, Maine, New York, and Vermont have all shown positive menthol sales cigarette increases, with Rhode Island reporting a 46% increase and New Hampshire having an 88% increase in menthol cigarette sales. Maryland will experience the same cross-border activity with consumers traveling to Delaware, Pennsylvania, Virginia, and West Virginia. A ban will also strengthen an existing illicit market with criminal elements willing to sell menthol cigarettes and flavored tobacco products to anyone who has cash. With national surveys reporting that underage use of tobacco products is at historic lows and declining, there is no need to ban all flavored tobacco products that legal age adults desire to buy. In response to the Attorney General, the FDA has published studies that 90% of underage youth obtain tobacco and vaping products not from retail stores, but from what are called social sources. That includes older friends, siblings, parents, or strangers. On behalf of our Maryland retail members—
but you have reached your 2.5-minute limit if you want to just wrap up.
Yes, on behalf of our Maryland retail members, I urge you not to support Senate Bill 177. Thank you for your time.
All right, Senator Bottle has a question for you.
Thank you, Madam Chair. Just real quickly to the gentleman that last spoke. So is your concern about tobacco products, or does it also include the flavored e-cigarettes?
It includes all flavored tobacco products and flavored electronic cigarettes. If the issue is vaping, and I listened to the prior testimony, then perhaps we need to focus on that issue and in terms of underage use. But in terms of all the other products, it seems that the main concern is vaping as opposed to menthol cigarettes, cigars, flavored smokeless tobacco, pipe tobacco. Your average pipe tobacco smoker is 54 years old.
Thank you.
You're welcome.
Thank you. All right, we're moving finally to Isaac Mayer.
Madam Chair, members of the committee, Isaac Meyer, Compass Government Relations, on behalf of the Maryland Vapor Alliance, here in opposition to the legislation. Let me be clear, while we are opposed to the bill, we are not opposed to working with the committee on coming up with sensible legislation amendments. For example, we do have extensive amendments on Senator Kramer's bill that we'll be hearing later. You know, our opposition to this bill is that it does not address the access issue. If we ban flavored electronic smoking devices, Juul and other products, big tobacco products, will still be on every single corner shop. The only thing that's going to happen is our client, the Maryland Vapor Alliance, about 175 brick and mortar shops that sell open systems, they will be the ones that go out of business. These are adjustable open systems with adjustable amounts of nicotine that help adults wean off their tobacco use because they were addicted to cigarettes for 20 years. Last session, they wrote 5,000 postcards to the Maryland General Assembly explaining how they smoked cigarettes for 20 years, 2 packs a day, and the only thing that helped them quit was a flavored open system. It's this. If you look at the FDA enforcement data, you'll see that of the several hundred violations for sales of electronic smoking devices to minors, almost exclusively, and when I say exclusively, I believe all but one, was a closed system product that's owned by a big tobacco company like Juul. So we could have very easily offered up an amendment asking for us to exempt the brick and mortar vapor shops. However, we think that Senator Kramer's bill is bringing a robust, comprehensive approach to regulating the vape industry. Now, we certainly have amendments to that bill, and we're happy to discuss those later on. But we believe that this issue should be addressed. We do believe that open systems should be protected for adults to use to continue weaning down their nicotine use. And with that, I'm happy to answer any questions.
Thank you very much. Okay, we're going to end testimony on this bill for now. There actually are 7 pages of additional people voting in favor. There's about a half page of people voting just to give information and 3 pages of people who are unfavorable. So it's a very important piece of legislation with a lot of interest on all sides, which the committee will need to consider in some detail, including any amendments that have been offered before we vote on this bill. And we thank everybody who's testified on it. Next will be Senate Bill 215, which is my bill. And I'll do that next. And Senator, our Vice Chair will be in charge.
Okay, we've got you, Madam Chair. Senate Bill 215, Chair Kelly, it's your bill.
Okay. Mr. Vice Chair, members, Senate Bill 215 has been requested by the Vital Statistics Division of the Maryland Department of Health in order to systematize the preparation of birth certificates for newborns who were carried by gestational carriers. Maryland is one of 15 states which mandate that certain insurers cover infertility treatments. Maryland has not standardized by statute any protocols for preparation of birth certificates for the children born of gestational carriers to whom the children are genetically unrelated. In these cases, the intended parents are required to get an order of parentage by applying to a Maryland court proper jurisdiction. Following birth, these families need birth certificates for these kids. It's the purpose of Senate Bill 215 to establish the information which the intended parents and the attending obstetricians or midwives must submit to vital records for preparation of such a child's official birth certificate. Senate Bill 215 requires that when submitting information required by vital records for preparation of the birth certificate for a child delivered from a gestational carrier, the intended parent should also include a copy of the order of the court establishing parentage. Senate Bill 215 also designates the categories of information to be submitted to vital statistics for preparation of the child's birth certificate, including the delivery, that this delivery was by a gestational carrier, the identity of the gestational carrier, relevant medical information regarding the gestational carrier as well as regarding the delivery, and information regarding the intended parents. The health department is required to adopt regulations to standardize all of these requirements, including the sealing of the forms and the registration of the certificate of birth in accordance with the order of the court. Senate Bill 215 sets no new policy regarding whether gestational surrogacy should be permitted in Maryland. Governor Schaefer vetoed bills which would have outlawed gestational surrogacy. Senate Bill 215 in 1992 and Senate Bill 171 in 1994. In each case, the General Assembly, just a minute, if I can turn this page. The General Assembly failed to override either veto. Therefore, our silence as the General Assembly had the effect of endorsing what has now become several decades of collaborative reproduction in Maryland. Senate Bill 215 brings needed standardization regarding post-birth paperwork needed to seal certain documents and to provide birth certificates for the children born in Maryland as a result of gestational surrogacy. I therefore urge a favorable report of Senate Bill 215.
Thank you, Madam Chair. Before we go to, we only have one witness, but before we do that, any questions for Chair Kelly on Senate Bill 215? Okay, seeing none. So our only witness on this bill, at least oral, there's a written testimony, is Jennifer Fairfax. Ms. Fairfax?
Yes.
You have 5 minutes.
Thank you. Thank you. Good afternoon, Senator Kelly, Vice Chair, Senator Feldman, and the rest of the committee. Thank you for letting me speak today. Some of you may have heard me before speaking on adoption and surrogacy related issues. I am an adoption and ART attorney. I'm licensed in Maryland, DC, and Virginia. I practice all over the state of Maryland, and gestational surrogacy has been an area that I've been practicing for over 20 years in Maryland. It is not prohibited, and therefore it is moving forward, and intended parents and gestational surrogates are entering into agreements in Maryland. Children are being born, birth certificates are being issued, court orders are being granted. I presently have gestational surrogates or intended parents in many, many counties across the state. Right now, Carroll, Prince George's, Baltimore, Montgomery, Anne Arundel, Frederick, Charles County, St. Mary's County. In every jurisdiction in this state, there's likely a gestational surrogacy arrangement on some level. What this bill does, it doesn't really weigh in on gestational surrogacy. What it does is it organizes how the birth certificate process is handled really within vital records. Some of the challenges that we've had is each hospital kind of does the paperwork differently. They have their own internal processes, and even though there's been instructions, they just send it in differently, and it creates some confusion. It creates more work for the Department of Vital Statistics, and it can delay things. This bill just really organizes and says this is exactly how it's done in every case. In almost all of these arrangements, we have court orders of parentage by the time the surrogate is 4 to 5 months pregnant. So the paperwork is there well before the birth and at the hospital. And truly what this does is sort of codify this is exactly what the hospital is supposed to do, what information is supposed to be given to vital records so that vital records can properly register the information, both about the surrogate, the woman who gives birth and her background and medical information, but also about the intended parents, the legally recognized parents of this child, so that a birth certificate can be issued in their names. Everything's placed under seal. And so this statute is really something that really needs to be put in place to help and protect these families, and really to just make this process smoother, more efficient, less costly for everybody. And therefore, I urge you for obviously a favorable finding on this bill. Thank you.
Okay, thank you for your testimony.
Are there any questions?
Yeah, any questions for Ms. Fairfax?
Oh, I'm sorry.
Yeah. Okay, seeing none, don't believe I see any. That concludes the bill hearing on Senate Bill 215.
Thank you. And now, Mr. Vice Chair, you're going to be up with Bill 35. And you're on.
Okay, thank you, Madam Chair. So let me start by saying that there's a lot of takeaways this year from the pandemic, and one of the takeaways from the last 10 months in the country has been to highlight the fact that we have some very, very different economic realities facing different parts of our economy. And so on the one hand, we've got a segment of our society that's doing really pretty good. We've got a record stock market, we've got low mortgage rates, people are buying a lot of new houses. That's one reality. On the other hand, you've got another world of folks struggling with lower wages, trouble affording healthcare, little or no savings put away for the future. And you've got small business against big business. You've got the bigger businesses with deep pockets, in many cases done pretty good. And then you got the small guys, maybe not so much. And then you have, I think, some uneven issues economically within regions. You've got some communities that have weathered the storm pretty well, and you've got parts of our state and parts of our country, rural areas, which are struggling. And so looking ahead, I think we have a huge opportunity in certain sectors, particularly the construction industry. Construction workers were deemed essential this year. And we as a nation are in some dire need of infrastructure, renovation, maintenance, and repair. We've got hospitals to build, healthcare facilities. In all cases, though, we need a skilled workforce, and the need for training working men and women with certain license certifications, whether it's state highway work, mechanical, electrical, is more critical than ever, which brings me to the topic of prevailing wage. Now, we had a similar discussion a couple of years ago in this committee back in 2019, just 2 years ago, about when we raised the minimum wage. And we made as a committee, the argument that in part, the reason we did that was we need to pay folks enough so they aren't on the public dole for healthcare. They have money to roll back into local communities, which in turn generates more sales tax, payroll tax, income tax for our state. And what we're talking about in the context of prevailing wage requirements for public work construction projects is the importance of a wage. And we're talking about prevailing wage. We're talking about the essentially payment of wages and benefits that a majority of workers in the construction space in that particular region are paid. And so, at the federal level, we've had in place since 1931 something called the Davis-Bacon Act regarding federally funded projects. And now we have 32 states, including Maryland, that have state prevailing wage laws. And so some of the benefits we've seen over time, and there's a lot of data on this with respect to prevailing wage. Number one, you've got a higher incidence of the supply of apprenticeship programs, which leads to higher wage and economic opportunities for less educated workers, apprenticeships to train our next generation of skilled workers in Maryland, which includes women, minorities, veterans. Very important that we have a pipeline of apprenticeship programs. Health and pension benefits. So with prevailing wage comes a higher incidence of folks that are able to get health care coverage, pensions for their future for construction work. The prevailing wage requirements also mitigate the shifting of healthcare coverage costs to taxpayers. So there's Medicaid, and we have that issue. And finally, we have prevailing wage in construction projects in the public space has the effect of injecting economic stimulus into local economies, more incidence of hiring local workers versus out-of-state workers. And again, more tax revenue for our state, payroll tax, sales, income tax. So with that backdrop and background, I turned to Senate Bill 35. And so I looked at our current prevailing wage laws and when they kick in and when they apply to our public works projects with an eye towards essentially expanding opportunities for more small and medium-sized companies, expanding local workforce and training opportunities, expanding access to healthcare and pensions, while also injecting, as I mentioned earlier, economic stimulus into places that could certainly use it. And one of the main issues right now in our state is we have a very highly restrictive set of criteria for when prevailing wage is applicable to public work projects. And so we have essentially two-pronged gauntlet that you have to get past under current Maryland law, and I'm proposing two very narrow specific changes. So first, under current law, prevailing wage doesn't kick in unless the project is $500,000 or more at the state level. When we're talking about these state projects, that is, I'm going to say this a couple times, the highest threshold of any state in the entire United States, that $500,000. Only when the project is above 500 does prevailing wage kick in. Again, the highest threshold of any state in the entire United States. By comparison, at the federal level, it's $2,000. Project is $2,000 above prevailing wage kicks in. And the net effect of it really is problematic. So you're really, for a small guy, and a lot of the contractors that are impacted, you're gonna hear from some of them, we're talking 2-3 person shops. We're talking 5 or 10. And they have very limited bonding capacity or authority. And so for them, these projects are pricing them out. And so the first change I'm proposing in Senate Bill 31 is to take that $500,000, the largest in the threshold in the United States, and take it down to $250,000. That really frees up a lot of the smaller guys, minority-owned businesses, to be able to compete for these projects. So that's number one. The second hurdle that we have in the current prevailing wage law is that we have county projects and other kinds of projects that prevailing wage kicks in, but only if 50% of those projects are funded but with state dollars. So for example, if you have municipalities or county projects and all the money's coming from the county and municipalities, unless there's 50% coming from the state, prevailing wage law is not applicable. And I should add, there's a separate 25% state funding for school construction projects. This bill does not touch the whole school construction stuff, okay? That's a whole other can of worms, and that's not part of this bill. These are for projects that are not school construction. It's that 50%. Now, a lot of states have different ways of doing it, but I'm told that this percentage requirement, 50% for state money, is pretty unique. So even if the county or municipality funds something with 100% public funds, there isn't much state money involved, I would say under those circumstances, prevailing wage should apply as well. And so this second change is to eliminate that 50% state funding requirement and kind of get rid of that. And so there's two parts of it. Now, the opposition in these prevailing wage bills will always say that the application of prevailing wage to a project increases the cost of the project. And I would direct the committee to the fiscal note. If any of you have your fiscal note, I want you to go directly to page 7. And if you look at page 7, the fiscal note writer writes as follows: the research findings related to the effect of the prevailing wage on project costs are inconsistent and often inconclusive. So there is no data really to support that it really increases costs on the project. But it goes on further to say on page 8 that a series of large-scale studies found no statistically significant effect of prevailing wage on contract costs. Now, it may increase the labor costs, but what the fiscal note writer says in that same section is that there's a higher productivity with prevailing wage, with the higher wages. It's that saving of money in other areas using lower cost supplies and materials may absorb some of those labor costs in order to be competitive in government procurement, but there is no statistical significant analysis to suggest that this increases the project cost. So here's the bottom line in summary. If you believe that the application of prevailing wages to more of our public construction work projects and the economic benefits flowing from that for healthcare, pensions, local workforce, local economies is a good idea, I think Senate Bill 35, these two changes I'm proposing make sense. If you think we should enact policies that level the playing field for more small minority women-owned businesses, then also you should support Senate Bill 35. And finally, if you think expanding the supply of apprenticeship and training programs for our next generation of skilled workers is a good idea, then Senate Bill 35 is for you. And so for all those reasons, Madam Chair, I would ask for a favorable report on Senate Bill 35. And I know we've got a few witnesses in support.
Thank you. Do we have any questions? Senator Hershey.
Thank you, Madam Chair. Senator, thanks for your presentation of this bill. I'm a little bit confused on your comments about the public school portion of this. It looks like, can you explain, because on the third page, and the third page, or fourth, I'm sorry, the third page, we talk about now any project funded in whole or in part, and then you take out some language that has to do with or move around some language that has to do with the school construction in elementary and secondary schools. Can you just
sure? And I think
that again to make sure I understand that, please.
I understand. So Senator Hershey, if you look at, I think the fiscal note writer did the committee a good job. If you look at page 2 of the fiscal note, and she does a good job. She specifically says the bill affects several types of public work projects not currently required to pay prevailing wage, and she lists 5 categories right here. And so with respect to local government non-school projects, they're funded with 50. So the 500 goes down to 250 for everything. But
so that means it just kicks in earlier, right?
Correct. But that 25%, I mean, we got 2 different sort of parts of this current law. We've got the 500,000, which under this bill goes to 250. But then you have this separate thing for the 50% of state funds, which for school construction is 25%. And so for schools, we still are at that 25% state funding requirement. That's not altered by the bill, but we are, so I'm not sure if that answers your question. That 50% goes down to basically, if it's 100% county municipal money and no state money, for non-school stuff, prevailing wage would kick in. Again, non-school, but for schools, it's still you still need 25% state kicking in. That the school construction is unchanged for that percentage applicability, but the 500,000 is now 250.
So that's what I would see. So if a smaller school construction project, for instance, a project that might have been $300,000, under this bill now, previously you would not have to go to the more expensive prevailing wage contracts. Now you would have to go into that because it falls less than 500,000.
Right, so if it's 250 or above, that's a fair point. So if it's 250 or above, is the way I read the language. If it's 250 or above, instead of the 500 or above, you're right, you would be prevailing wage.
Okay.
The 25% state part that's not unaffected by the bill.
Right, and a brand new school construction project, the 250, the 500,000 to 250 doesn't kick in. That's at that lower, that's already at that low threshold of 25%. If it's 25% or more, then we have to again go to this more expensive prevailing wage method of building projects.
Right.
And again, I think that's what's a little bit difficult to hear, because I certainly agree that we need to do whatever we can to try to help these smaller businesses, but I kind of fail to understand how requiring prevailing wages on state projects helps small businesses, because what we seem to see a lot of times is that these contracts, especially the prime contract, goes to these bigger, massive construction companies that come in and can meet these requirements. And the smaller mom and pop type construction companies really can't bid into these projects that have these prevailing wage concerns, not just because of the cost of it, but because the amount of paperwork and bookkeeping that's necessary to bid into one of these projects and then actually implement the project. So, you know, I see that the fiscal note writer says that these aren't more expensive projects. We've seen over and over again that they certainly are. You know, into the 15% and higher cost. But really, I would love to see a study that says who's getting these projects and what are the size of the contractors that are working on these projects. Because again, as I continue to hear, the small mom and pop contractors are just kind of priced out of this. The contractors, you know, out on the Eastern Shore that still do their estimates on with pen and paper, you know, cannot find ways to break into this and do the work. And unfortunately, we end up just seeing a number of contractors from the Western Shore come over and do projects and take away jobs from local contractors. So
well,
I just think we
Chair,
need to be cautious about that.
I totally hear you. And that's why I brought some witnesses who are actually in the industry.
Great.
And some of the smaller guys who will explain their story as to why going from 500,000 to 250 frees them up to bid and levels.
To bid into it, yeah.
So
okay.
I'll defer to those witnesses who are actually in the industry.
All right, thank you very much. Thank you.
Okay, thank you very much. Now the first witness is considered our main witness, and we'll have 5 minutes. Other witnesses will have 2.5, and we'll ask everybody to try to behave so we can still be able to think by the time we finish all of this. Everybody's bill deserves to really be heard and understood. Okay, so we're going now to Jeff Guado.
Good evening, Madam Chair. Can you hear me okay?
Yes.
Very good. Yeah, we support the bill. I represent the Building and Construction Trade Council, which is 25 local union building trades. We're private unions, and we are dependent upon our contractors to bid work successfully and keep us employed. And as Senator Hershey said, he talked about the big contractors getting these jobs. That may be true at a GC level for some contractors, but for the most part, our contractors are small shops, 5 to 10 men or persons, I should say, and even 2 to 3 person shops. Someone who's just starting out, is also doing the estimating, the sales, and the installation. They handle everything. And we feel with the lower threshold that this levels our playing field. It gives a chance to put our members to work. Our benefits include health care for all of our members, plus their dependents. There's no pre-existing conditions. We contribute into the apprenticeship training fund as part of our negotiated wages, around $22 million a year spent in Maryland. It is not funded by the state at all. It's self-funded. There's no tuition cost to these apprentices other than they buy their books. The money that comes out of prevailing wage is spent directly back into the community. It supports the local businesses. It gets an influx of money that's going around from the dry cleaner to the movie theater. Maybe not as much now during the COVID pandemic. That is certainly how money runs through the community, certainly probably with the restaurants on the takeout business. It increases the payroll taxes and sales taxes. And there's a dire need for infrastructure coming out, for not only for the state of Maryland, for the country as well. And these projects need to be done under prevailing wage. Some of them are smaller. Some of them are maybe set aside painting contracts or small GC contracts with some basically labory work. But those people can work, they can make a living wage, support their families, provide themselves with health care, go get a career training. The apprenticeship schools also do journeyman training as well, that you can advance your career. And we urge for a favorable report. Thank you.
Thank you very much. Are there questions? All right, Senator Hershey.
Thank you, Madam Chair. I'll make this one quick. Jeff, I know you're one of the experts and certainly know we've talked about this a number of times. One of the things that certainly has been brought up is there a regional cost of living difference in Maryland state prevailing wage law?
It's usually the surveys that are submitted to the Maryland Department of Labor that determines the prevailing wage in the state or in a region.
In a region, so you're saying that there are different rates within different regions of this state?
Yes, it's not statewide, flat across the board prevailing wage for every craft. A prevailing wage in Baltimore City would be different, say, from prevailing wage in Prince George's County because of the surveys that are submitted.
Okay, I've heard a little bit different that the rates aren't the same or are the same in a lot of the rural areas as Baltimore City. And again, you mentioned that this kind of somehow levels the playing field. I'm not sure how that is actually the case, but I think what it ends up doing is it's forcing state entities to pay a certain rate that actually some of the smaller contractors have to now raise the amount of money that they're paying individual employees. And then you mentioned 2 or 3, companies with 2 or 3 people. Again, if you could go back and tell me, I thought this is an awful lot of work that needs to be done from a bookkeeping perspective in order to meet the state's requirements on how contractors or how employees are paid. Is that not correct either?
It's not a tremendous amount of paperwork. There's a certified payroll submission back to the Department of Labor. Done easily, I'd say, through a QuickBooks application. It's not a overbearing burden or overwhelming burden, I would say, for any contractor.
Mm-hmm.
To me, contractors know what they're bidding going in. They know their material rates are going to be what they are. 2x4 costs the same for, I'll say, a non-union as it does a union company. But the labor usually comes in where you're more productive with a better trained workforce. There's less punch list, less going back. You get your final draws when you're due, that type of thing. Your inspections pass. For small contractor, and I used to be one, I was dependent upon getting my inspection to get a draw before I could pay my suppliers, my labor, everything. And if I didn't pass my inspection, if there was something done incorrectly, I didn't get paid. I had to correct it first. So when you have a skilled workforce that is familiar with building codes, knows how things are done, they're given a definitive plan on how to install it, you get it done much better.
Okay, well, you always know that I think that's an unfair comparison to say that union workers are more skilled and do a better job than the non-union shops. I kind of take offense to that. I know there's a lot of contractors out there that are represented by some advocacy groups in Annapolis that actually do an outstanding job of work. But I know what you need to say, but at the same time, I need to say that as well too. I don't think that's a fair assessment. So.
Understood,
Okay.
sir. Very well. Thank you.
All right. If there aren't additional questions at this time, we're going to Heath Yancey. You got to unmute yourself.
This is Heath's first time on a Zoom call.
You did it, but you put it back again. You just got to get rid of that little X.
Heath, unclick your button on the microphone. Unclick the red line on the microphone.
Oh,
Okay, now you're fine.
oh, I'm good now?
Yes.
All right, Madam Chair, Senator, how y'all doing?
Okay.
Okay, I think Senate Bill 35 should be a law in the state of Maryland. This bill is for the youth coming out of high school, okay, so they can live a productive life and have a good future. If this bill becomes a law in the state of Maryland, it would keep surety bonds low, so small business can get a chance to bid in the construction field. Because some kids, just don't want to go to college when they get out of high school. Apprenticeship program, small businesses, and our youth is how our economy grows in the state of Maryland. Apprenticeship program teaches numerous of trades. All trades have a certain amount of school they attend, like the roofers, electricians, plumbers, steam fitters, iron workers, and carpenters. And the good thing about the apprenticeship program is that a person works while they go to school, so they earn money. At the end of each apprenticeship program, upon graduation, he or she becomes a journeyman, which is the top of the field that they have chosen. Me personally, the apprenticeship program, oh, wait a minute. I'm sorry, apprenticeship program, teaching, wait a minute. Oh, I'm a small business owner. The name of my company is, I represent Local 30, Roofers Local 30. The name of my company is Yancey Roofing and Waterproofing. My Maryland certifications are MBE, SBE, DBE, ACDBE, and on the government side is SDVOSB, which means Service Disabled Veterans Owned Small Business. I've been in the military for 24 years and retired and did 2 tours in Iraq. I also use apprentices, but I have to win to keep the youth in school and working. Small business play a big role in our economy. Our youth need to learn a trade or at least go to college. All people are not college bound. They probably have like financial problems or they just rather work. Let's give the youth a chance to decide. I approve of the Senate Bill 37, surety bonds so they stay small. So small business like myself can have a fighting chance to win bids and keep the apprenticeship program going on. The big company should not dominate the workforce or the trade. That's it.
Thank you very much. Are there any questions? Okay, we're going next to Lanique Esting. Mr. Esting, we can't hear you yet. Now.
Oh, yeah, I got it. Okay, thank you. Yes, Estimate Enterprises certified MBE formed in the state of Maryland in 1996. We're currently located in Atlanta, Maryland, and we are a signatory contractor to the local Carpenters Union. As an MBE based in the state of Maryland, the Carpenters Union provides us with skilled workers that we need to complete large and small scale construction projects. As a business owner, I have dozens of things to manage on a day-to-day basis. Finding skilled workers is not one of the concerns I have to deal with as an owner. With a simple phone call, I can have dozens of skilled workers at a job site in less than a day. Access to a pool of skilled employees puts me on a level playing field with larger companies. Lowering the prevailing wage threshold to $250,000 would allow us the ability to competitively compete with many state-funded projects that we currently would not pursue because we would not be competitive. Often we notice some projects in our county that would be a great fit for us, but we do not pursue them because they lack the prevailing wage requirement. To find state-funded prevailing wage projects, we often have to travel long distances away from our office. This puts us at a disadvantage because of the added travel costs. If we are able to pursue more projects that are closer to our office, we would be more competitive and hire more local residents. In areas of the state that have higher costs of living, such as Prince George's County, We could provide more apprenticeship opportunities to young men and women, thereby increasing the number of skilled workers in our county. In closing, we urge the committee for a favorable report. Thank you.
Thank you. Are there any questions? All right, we appreciate your testimony. And we're going next to Drew. Is this Drew? Oh, I'm sorry, to Clayton Sinyai.
Okay.
Thank you, Senator. I'm Clayton Sinyai from the Catholic Labor Network. The Catholic Labor Network is a national organization with members in Maryland and across the United States that exists to advance Catholic social teaching on labor and work. In 1891, Pope Leo XIII laid out the premises of the Catholic Church's teaching on work and wages in his encyclical letter Rerum Novarum. He said, "Let the working man and the employer make free agreements, and in particular, let them agree freely as to wages. Nevertheless, there underlies a dictate of natural justice more imperious and ancient than any bargain between man and man, namely, that wages ought not to be insufficient to support a frugal and well-behaved wage earner. That is, every worker has the right to a living wage, and if the labor market does not provide for this, naturally, society must intervene. Public contracts should serve as a model for the rest of society, including in our policy on wages. In public construction, prevailing wage requirements help guarantee that construction workers earn a living wage, and that construction contractors who pay a living wage are rewarded with a fair opportunity to win public contracts. For that reason, the Catholic Labor Network supports efforts to extend prevailing wage requirements to cover more public contracts in Maryland. We urge the committee for a favorable report. Thank you.
Thank you. Are there any questions? Okay, and now we will go to Drew Jabin.
Thank you, Chair, Vice Chair, members of the committee. Drew Jabin on behalf of the Maryland Association of Counties here in opposition to Senate Bill 35. You all do have my written testimony and I will keep this brief. So you've heard what the bill does. Even the smallest amount of state funds and prevailing wage would kick in. The current law is sensible, where if the state is the majority partner, this applies. It's important to align these prevailing wage practices with the practice that empowers the party providing the majority of funding with certain management and oversight controls. As the sponsor mentioned, studies do contest the exact amounts on project cost increases, but they do increase. And as a previous witness mentioned, we're at a time where we're in dire need of infrastructure, and total project costs will go up for counties and could potentially result in fewer local projects being funded, which is not what anyone wants. So for these reasons, MACO opposes Senate Bill 35 and requests an unfavorable report. Thank you.
Thank you. And this is the last of the oral testimony.
Madam Chair, could I ask one question of Drew?
Yeah, sure.
So Drew, just putting aside the percentage you mentioned, you know, the 50% issue, just the $500,000 numbers. So, I mean, I represented, and I believe it to be true, that the $500,000 threshold number is the highest threshold of any state in the United States. Is that, do you agree with, is that accurate based on your own research? And if so, why would we, you know, what is the rationale or public policy rationale for being at a number that is higher than any of the other 49 states?
So I believe you, Vice Chair. If you have done your research and you say it's the highest, then I will take your word for it. And I'm definitely willing to work with you on possibly a compromise or talk through the issues we have. Our focus is more on the 50%.
Okay, so that's more your focus. It's not the 500 to what I'm proposing 250. It's about the percentage issue of 50%. Okay, fair enough. I just wanted to lay that out where the differences are, Madam Chair. Thank you.
Okay, I was about to say that there are 21 additional witnesses who couldn't testify orally because of our limits, but they are favorable and there are 2 additional unfavorable. Okay, and that ends the testimony on that bill. We're going next to Senator Hayes, Senate Bill 211.
Thank you, Madam Chair. And good evening, Madam Chair and members of the Senate Finance Committee. Thank you for your time and consideration for the reintroduction of the Time to Care Act. I'm speaking to you today in support of Senate Bill 211, along with my panel members, Reagan Vaughn from Catholic Charities, as well as Aaron from Well Paid Maids. Laura Y. Dreyer from the Maryland Health Network, and Michelle Siri from the Maryland Women's Law Center. Most Marylanders, whatever their circumstances, will at some point in their lives need extended time away from work to provide necessary care for their family members or for themselves. A number of situations requiring leave may arise, such as welcoming a new baby or adopting a new child. Having care for an aging parent is a huge responsibility. As you all know, I've shared my story before where I had, the opportunity to be raised by my grandmother who stepped in the gap when I had some challenging times in my life. And now the roles have turned where, I'm also serving as a co-caregiver with some of my relatives and taking care of my grandmother after dedicating so much of her time and energy to me. The Time to Care Act establishes the Family Medical Leave and Insurance Program, which would make paid leave available to Marylanders up to 12 weeks following the birth of a child or for a needed caregiver. Family member is defined as child, parent. I think you can see that in the legislation. Support of this legislation crosses party lines. A poll of more than 1,000 Marylanders done in December 2020 yielded 88% favorable of this proposal. Having to take unpaid leave forces families to endure financial hardships, mental and physical distress, which is detrimental to not only the employees, but the employers, expecting quality output as well. The US is the only industrialized country to not guarantee some form of paid family leave for workers. Only 17% of US workers have access to paid family leave, and fewer than 40% have paid personal leave for short-term disabilities. Nearly 25% of women, for example, take 10 or fewer days of parental leave, potentially putting themselves and children at risk physically and emotionally. This pandemic of COVID-19 has only heightened the need for a sensible paid family leave, and that is what the Time to Care Act does. COVID-19 has emphasized the importance of paid leave, with 350,000 and climbing Marylanders contracting COVID. Many have been forced to take leave from work and putting their family's economic security in jeopardy. This legislation will provide a wage replacement during the leave period, ranging from $50 to $1,000. Benefit level is calculated based on the Maryland workers' average weekly pay, approximately about $1,080. Last year, the bill got very close. However, the clock ran out on us due to COVID-19 and the short session. This bill is very similar to last year. However, there are some amendments that have been circulated to each of the members to address some of the concerns that various stakeholders agreed to last year. And so I look forward to the rest of this testimony and the panel members that will speak today. But I will tell you, again, like I compared the other countries, a total of 9 states so far, and Washington, D.C., our neighboring jurisdiction, has already moved in this direction. Maryland is kind of slow to the table. I will say to those who may be interested in this piece of legislation, it is my intent to get the chair's permission to convene the stakeholders after the hearing and testimony has been provided today, to see where there's common ground and how we can move this legislation forward. With that, Madam Chair and members of the committee, I thank you for the opportunity to share with you this afternoon.
Thank you. And as always, if you want to put together a work group to decide what to do with the amendments and so on, that's fine. And I'm sure you'll have members of the committee that would be interested in helping you with this project.
Thank you.
Are there questions? All right, if not, now the one witness who's going to get 5 minutes is Regina Vaughn, and then the other witnesses will have 2.5 minutes each. So Ms. Vaughn.
Good afternoon, Madam Chair and members of the committee. My name is Regan Vaughn. I'm the Director of Advocacy for Catholic Charities of Baltimore. Catholic Charities provides care and services to Marylanders in need through over 80 programs at more than 300 sites in Central and Western Maryland. I'm here today to ask for your support of SB 211, the Time to Care Act. The Time to Care Act is important to Catholic Charities because it touches every aspect of what we do. Prior to COVID, when I traveled to our Head Start program in Westminster, the teachers brought up paid family leave before I could bring it up. When I talked to the residents at our senior housing communities in Reisterstown and Fullerton, I hear about how their neighbors in the community were forced to leave for nursing home facilities because their family members couldn't take the time to care for them during a bout of illness or injury. When I talk to our administrators at St. Vincent's Villa, which serves children from every county in the state, I hear about families desperate to help their children overcome significant emotional and behavioral needs while worrying about losing their job. There are stories throughout the agency of the collateral consequences of serious illness in a family. And what's most striking to me about this is I never have to go looking for the stories. They're all over. I brought a witness down a few years ago to testify in support of the temporary cash assistance budget, only to have her start her testimony with, "I lost my job when my doctor put me on restricted activity during my pregnancy, and that's why I received temporary cash assistance." Last winter, our communications department ran a story about the Hardy family and featured how they had to use 2 different lines of Catholic Charity Services. You'll see their story in my written testimony, but Mrs. Hardy lost her job while she was trying to balance the needs of her work with her family, with her son's severe emotional needs. The family then lost their home and ended up in homeless shelters. Our experience isn't unique. If you look at the supporters of this bill, they represent a wide range of constituencies. SEIU 1199, the Maryland Developmental Disabilities Council, the NAACP Maryland branch, the Maryland Legislative Agenda for Women, the Mental Health Association of Maryland. You also have written testimony from numerous small business owners who talk about how they want to be able to offer this to their employees. Now, you've heard this bill before, and Senator Hayes gave an excellent description of what's included in it. So I'd like to concentrate the rest of my testimony on how the bill has evolved over the years. We fully understand there are concerns from employers about cost and implementation. And I can tell you the coalition has been open to discussions, and we continue to be open to that. We've met with various groups, representatives of small business, large business, the insurance industry have all come forward to us with requests. And as a coalition, we've gone through those requests, and each of them were evaluated by answering 4 questions. 1, does it remove workers from the program as proposed? 2, does it take away any proposed job protection? 3, does it reduce the categories of leave that would be covered? And 4, does it further marginalize low-wage workers and workers of color? So after evaluating each of the proposed amendments, we ran them through those tests, and there are a number that we were able to incorporate into the bill. We amended the definition of family member to match the Healthy Working Families Act. We added requirements that individuals must provide certification to support their claim. We made it explicit that the cost of the program would be borne by the contributions to the program. It would not require general funds. We specified that the fund would collect contributions for 18 months prior to issuing payments. We explicitly put in the bill that the cost of contributions would be shared 50-50 between employers and employees. We explicitly stated that the maximum contribution rate would be 0.75% of payroll. This gives a cushion because the projected contribution rate is only 0.67% of payroll. We limited contributions so that nobody's contributing over the Social Security wage base rate. We added language that allows employers who have better programs that include all the benefits and rights that they would be exempt from contributing to the public program. We clarified that employees would have to take the family leave and FMLA leave concurrently. And we also clarified that companies who are already providing either paid family or paid medical leave could require their employees to use that leave concurrently with the benefits under family. We are willing to participate in the stakeholder groups that Senator Hayes puts together. We're not unmoving on this bill. We just want to make sure the underlying principles of this bill stay intact. That all Maryland workers should be able to access partial wage replacement when they need to care for themselves or a family member, and that at the conclusion of their leave, they're able to return to their job. This is a bill that's good for workers, it's good for families, it's good for children, and it's good for Maryland. I would ask that you please move favorable on SB 211. Thank you.
Thank you very much. Are there any questions? All right. Not, we're going next to Regina, no, we're going to Aaron Sayedian.
It's just perfect. Aaron Sayedian. Yes, thank you, Madam Chairwoman. Thanks for having me today. My name is Aaron Sayedian. I live in Montgomery County, and I'm the owner of Well Paid Maids, a living wage home cleaning company that operates in the DC area. As a small business owner who employs and serves Marylanders, I'm eager to see paid family and medical leave enacted in our state. After having provided paid family and medical leave to my employees for over 3 years, I can tell you that in addition to being moral, logical, and practical, that paid leave is affordable and beneficial for businesses. First things first, let's talk cost. As this bill is debated, one thing everybody should know is that what we're talking about is not expensive. I have dozens of different costs that I'm trying to control as a business owner, but paid leave is not one of them. It doesn't even rate, I don't stress about it, I don't even feel it. So for context, my business participates in the DC Paid Family and Medical Leave Program, which is entirely employer paid, and it costs me 0.62% of payroll. Given the fiscal projections for this bill and the structure of splitting it between employees and the employer, I wouldn't let anybody convince you that this proposal is anything but affordable. And before we leave the topic of cost, let me just say that for the first 2 out of 3 years that I provided paid leave, this public program that I participate in did not exist. I used to purchase private short-term disability insurance on the open market, and the cost was 3 times as high as what I pay now for a worse plan, meaning skimpier wage replacement and no family leave. So please know that the private sector alternatives to a public social insurance program are inferior and more costly to business owners. So to recap, this is cheap, but it's not just cheap, it's a great deal because as a business owner, you get a lot of bang for your buck. My employees do hard work, bending, scrubbing, lugging, scraping, you name it. If somebody gets injured or gets sick, I need them to rest for every single day the doctor recommends in order for them to come back safely. Now, I have a generous paid time off policy, 20 days of PTO per year, but PTO does not and cannot cut it. There are so many illnesses and injuries and life events that we just know take longer. So by being able to use paid leave, my employees can actually take the time they need when a situation arises where it would otherwise be financially impossible for me to support it via PTO, or a situation that they try to work through, risking their health and safety, ruining their job performance, and increasing the likelihood that they'd have to quit. So to sum it up, paid family and medical leave has a negligible cost for businesses, and it provides tremendous benefits. And I'm not the only business owner who thinks so, which is why Amalgamated Bank, Ace Hardware Stores, Red Canoe Cafe, Atwater's, Zeke's Coffee, and the Mason-Dixon Company have also sent in letters of support. In closing, I would be skeptical of any business or business group that claims this proposal is burdensome for employers. In fact, what's burdensome, not just for employers, but for employees and the community, is not having a state program. I'm happy to answer any questions, and thanks again for having me.
Thank you very much. Are there any questions? All right, Senator Reedy.
Thank you, Madam Chair, and thank you for your testimony, Mr. Said. And I'm curious, with the way it works in DC, is there ever a time where you have someone want to claim this that you feel is not, there's a dispute, that something they're claiming should not apply to this? Who governs those disputes, or how does that dispute resolved?
I'm not sure how a dispute like that is resolved, but I can tell you that I haven't had any situation like that come up. The 2 times that we've used the public program so far were for maternity leave, and it was very cut and dry, very uncontroversial. And, you know, I run a small business. I don't expect my employees to lie to me. It's not the kind of thing where I'm actually, you know, really worried about fraud or misuse or anything like that.
Right. I mean, but you'd acknowledge there could be some businesses that are a little bit larger that might have that concern, or a different type of work that might yield there to be some conflict. They're not necessarily saying an employee would lie, but just that there would be some dispute about whether this should, the particular situation or instance should be their own personal PTO maybe versus this. I mean, would you acknowledge that that could be a problem for some types of companies?
I think in any large program, there are going to be gray areas and edge cases, and I would just expect that there would be a competent professional that's working behind the scenes in the program to handle any things like that.
Great. Yeah, I'd like to know, maybe not from you, because I understand you're here testifying about your own circumstance, of course, but that's a question I think we have to be sure we know the answer to is, how do we handle when there are disagreements and disputes, and whether this should be something that, businesses and employers should be funding or not. So thank you.
Thank you. Okay, we're going to move now to Michelle Siri.
Good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. My name is Michelle Siri. I'm the Executive Director of the Women's Law Center of Maryland. And I'm also here today representing the Maryland Legislative Agenda for Women, which has included SB 211 as one of its priority bills this year. For nearly 50 years, the WLC has worked to make systemic change in the name of gender justice. And make no mistake, the lack of paid family leave is definitely one of the biggest gender justice issues facing our nation right now. I'm here to tell you all that working women of this state are at a breaking point. We have been sounding the alarm for years, with 2/3 of women in Maryland being the sole, co, or primary breadwinners of our families, while simultaneously bearing the brunt of the caregiving. But now the pandemic has hit critical mass for working women, and what economists have dubbed the she-cession is wreaking havoc on our families. Women are overrepresented in many of the sectors that have been hardest hit: hospitality, leisure, restaurants, education. They account for as much as 83% of the jobs lost in those sectors. It's been even more devastating for Black and Latina women, who make up disproportionate percentage of workers in those sectors and who, not surprisingly, have experienced unemployment levels at an even higher rate than their white counterparts. While men have recently seen an increase in the job force, they gained 16,000 jobs in December, women lost 156,000 jobs during that same period. Put another way, in the last month of 2020, women accounted for all the net jobs lost in this country. That isn't surprising given everything that we know about women in the workforce. Everyone's heard about the need to shatter glass ceilings, but so many other barriers exist, particularly for folks in low-wage positions. Take the sticky floor, where women get stuck being unable to progress in their positions or in their salary, because every time a life event happens, a child is born, a parent is ill, a partner passes away, that woman must put her career on hold and get pushed back down the ladder of success. Then there's the leaky pipeline, where women enter the workforce at the same rate as men, but as they progress in their career, the number of women dwindle, being forced out of the workplace altogether due to competing work and caregiving demands. Both of those scenarios can be addressed by implementing paid leave, because we know that women with paid leave are 70% more likely to return to work after a major life event. So glass ceilings, sticky floors, leaky pipelines, forgive the metaphors, but it really does mean that our house is in shambles, and that all of you, the members of this committee, currently have the tools in your hands to fix this house up, to make it a home for the women of Maryland and their families. And for all of those reasons and so many more that everyone else has already said on this committee, on this panel, I strongly urge a favorable report on SB 211. Thank you.
Thank you. Are there any questions? Okay. Just so that you get an idea, colleagues, if you haven't been counting as I have, there are 52 persons with written testimony as favorable. There are 12 unfavorables, and there are 2 for just information and 3 favorable with amendments. So you get some, there's a lot of interest in this bill. Okay, at this point, we're going to Laura Wildryer.
That's it. Good afternoon, Madam Chair and committee members. Thanks for your consideration today of the Time to Care Act. I'm Laura Wheeldryer, Executive Director from Maryland Family Network. We're a statewide nonprofit and leading voice in early childhood. And today I am here to speak on behalf of babies and their parents in strong support of paid family and medical leave. Because early brain connections form the foundation for all learning and relationships that follow, parents and caregivers are on the front line of preparing our future workers innovators, citizens, and leaders. Too many parents, too many working parents are forced to choose between caring for a new child and their economic security. So I'm going to use my time today to talk about the powerful outcomes we can expect from time to care. You know already there are 9 other states plus Washington, D.C. that have passed paid family and medical leave. 0 to 3, a national organization has compiled the research on children and parents. And I could sit here in front of you today with a huge stack of public health research about the benefits of time for babies, for moms, and for dads. So here are the things we can expect in Maryland when we have time to care. I'm just going to tick through the list. First and foremost, reduced infant mortality rates. Second, long-term health benefits for our children, particularly striking for less advantaged children. This is linked to increased breastfeeding, children who make all of their well child visits, who get immunized on time, and there are long-term benefits for them and their families. Early detection and timely intervention for potential developmental delays. James Heckman, Nobel Award-winning economist, has studied interventions in the earliest years of a child's life and found that they provide an up to 13% return on investment for society at large. There are increased health benefits for new moms. That's because they see a reduced rate of postpartum depression and improvements in mothers' physical health. In addition, there is really striking and hopeful emerging research that this is linked to the prevention of child maltreatment. And the thinking here is that it's linked to reduced parental stress and depression. And finally, it is linked to increased engagement of fathers. And increased engagement of fathers in child rearing promotes long-term educational attainment for children and emotional stability. That's just a smattering of the public health research. I could go on, but I'm going to conclude by saying now is the time to secure the best beginnings for our children and the best future for our state by supporting Senate Bill 211, the Time to Care Act. I urge a favorable consideration. Thank you.
Thank you. Are there any questions? Okay. We also have Fiona Ong. Unfavorable.
Yes, thank you. Madam Chair, Mr. Vice Chair, and honorable members of the committee, thank you for allowing me to speak today on behalf of the Maryland Chamber of Commerce. The bill states that it is creating an insurance program to provide benefits for covered leave. As we have repeatedly made clear, we're not philosophically opposed to this concept, and we've tried to work with the stakeholders to develop a balanced bill in past years. But regardless of the merits of the bill's purpose, this is not the time to impose another economic mandate on employers. The pandemic has been devastating on Maryland businesses. Many have closed and others are barely surviving and certainly cannot afford any additional economic mandates. But even beyond the pandemic, we have fundamental concerns about the bill as drafted. We are concerned about the impact on many smaller employers, many of whom were already struggling following the minimum wage increase and paid sick leave. Other states that have enacted similar programs include an exemption or adjustment for smaller employers, but this bill does not. In addition, this bill does not take into account the impact of an extended absence up to 24 weeks, almost 6 months, with guaranteed reinstatement, particularly on a smaller employer. We are also deeply concerned that the actual language of this bill is unclear as to whether it is truly just providing benefits to cover unpaid leave to which an employee is already entitled, or if it's creating an entirely new bank of paid leave. Some of the bill language supports the latter, and we've cited this language in our written testimony. Other states have made it clear that their programs provide benefits and not leave itself. If this is a new bank of leave, this would pose an overwhelming and unworkable challenge to employers, many of them. There are a number of federal and state laws that already provide unpaid leave to employees for family and medical reasons, but the rights to leave under these laws are appropriately balanced against the rights and needs of employers, including the ability to verify the medical need for leave and to address possible fraud and abuse. And employers may even deny the leave if it would impose an undue hardship. Job restoration is not guaranteed, such as if there is a reduction in force, performance issues, or misconduct under these laws. But none of these concerns are taken into account in this bill. This bill empowers the state to act as the employer's human resources function with regard to this leave without any input from the employer. And this, as well as the other reasons set forth in our written testimony, is why the Chamber opposes this bill and asks the committee for an unfavorable report. And we would love to participate in Senator Hayes' work group. So thank you for bringing that up, and we would very much like to participate. And thank you to the committee, and if you have any questions, I'd be happy to take them.
Okay, you raised some interesting points, and so maybe it will be very important for the work group. What pre-existing leave might be incorporated as a part of this. I wouldn't imagine it would be on top of that. I think this is what they want as a final outcome. And okay, I won't say more.
I'm sure.
Maybe it would be important to discuss what a small employer is in your mind, since you didn't specify.
Well, thank you. The Family and Medical Leave Act, the federal law, says a smaller employer is any employer under 50 employees, which is quite large. I don't think we would we would not be asking for that. I think we're thinking more in the 15 to 20 range are really the employers that might have more difficulty in dealing with this.
Madam Chair, I'm sorry, I had a question.
Yes.
And so one, I think it was Comcast that raised the issue about, other leave and if they would be able to use that leave before. And so that's actually addressed in the bill. I would invite the person that's testifying to read the updated version of the bill because some changes have been made. And it sounds like the testimony is based off of last year's experiences.
Yeah.
But my question is, so this is the third year the bill has been introduced. 9 states have already passed it. Do you know of any other chamber that's ever came out and support the bill? As you said, you support it fundamentally, but oppose it. Do you know of any other state?
I'm sorry, I don't know that answer, but I did want to just point Senator Hayes that I am aware of the changes to the bill. I have reviewed the amendments to the bill. And we very much do appreciate the attempts to address that concern with regard to the use of the other types of leave. I would say it's not entirely clear in the bill what that actually means.
Right.
So does that mean you can require people to
both sing together, but we can't talk together? And I know you're trying to filibuster. I get it. All I'm saying is we'll talk about it a little bit more later, but we thought that we took the language that you guys recommended in previous years and adopted it. And so if that's not good enough, if the bar is moved a little bit, let's try to figure out what the reasonable language to agree on is.
Okay.
Thank you.
Thank you. All right, we're going next to Mike O'Halloran. Also, these are the unfavorables. Okay.
Sure. Thank you and good afternoon, Madam Chair, Mr. Vice Chairman, and members of the Senate Finance Committee. For the record, my name is Mike O'Halloran, and I'm here on behalf of NFIP Maryland in opposition to Senate Bill 211, legislation creating a paid family and medical leave insurance program, the funding of which is derived by employer and employee contributions. I'd like to focus my testimony on the costs of such a program. There are certainly technical issues with the bill, not least of which is the heavy-handed approach towards enforcement of this new program. But given the economic crisis we find ourselves in and the fact that it will take Maryland small businesses years to recover from it, I feel it's best to highlight the steep cost to implement and maintain this program. I'll start with the fact that 1 in 4 small business owners tell us they will be forced to close their doors for good if economic conditions don't improve soon. On top of that, more than 1/3 do not anticipate business conditions getting back to normal levels until 2022. Sales levels are still 50% or less than they were pre-crisis for 1 in 5 small businesses, with another 29% at sales levels of 51% to 75% before the pandemic set in. Acknowledging these realities for our state's job creators and passing legislation which will cost small business owners thousands of dollars each year should make this a non-starter. Small business owners also acknowledge the hardships their employees have faced during this crisis. Trust me when I say that they do. They were the ones that were forced to lay off or furlough them when they were made to close their doors or reduce their capacity. But small business owners did and continue to do everything they can to help their employees, offering flexible hours, remote working opportunities, and more. But their budgets can only go so far. That is why this one-size-fits-all mandate just does not work for Maryland small businesses. On the subject of powerful impacts, a preliminary analysis of this bill and its effect on Maryland's workforce shows it will cost 5,500 jobs in 2022. It's important to note that analysis is for the first year before benefits can begin being paid out. So it is logical to assume those numbers will only increase as small business owners are forced to hire new or temporary workers once employees begin taking advantage of this program. I'd also like to point out that this year's bill increases the wage contribution over last year's bill from 0.5% to 0.75%. That is certainly not a change we would like to see in any event. So with that, I appreciate the time to address the committee, and for these reasons, NFIB opposes Senate Bill 211 and requests an unfavorable report.
Okay, are there any questions? Okay, we're going next to Kaylee Locklear.
Good afternoon, Madam Chair and honorable members of the committee. Nice to see you. Kaylee Locklear for the record here on behalf of the Maryland Retailers Association. We're in opposition to the bill. And I just want to start by saying that this really is not the time to place additional burdens on employers. The fact of the matter is that many retailers, through no fault of their own, were forcefully shut down for almost 3 months last year because of COVID. And their sales have never returned to normal. That, coupled with the vast majority of shopping at Christmas occurring online, where many brick and mortar retailers will see major boosts in sales, and many rely on it for the majority of their revenue for a year. The combination of less revenue coming in, even now, additional costs for safety measures and PPE has left our members needing recovery time and help. And I would also add all of this together with increased sick leave costs, minimum wage increases that have not even come to fruition, and impending, although currently frozen, unemployment insurance increases unless money is moved to make the fund solvent again. And you all will be taking up yet another piece of legislation, adding additional wages hourly to employers and employees. And we've met with the advocates on this bill. My apologies, because I wasn't here earlier for some of the conversations, so I've only caught a little bit of this. But our organization has met with the advocates numerous times throughout the year. And although I did notice there are, Senator Hayes, some small changes that were made in this bill, I think you talked about that earlier, our recommendations have not been incorporated. One of the top issues being that this should be paid for by employees. And that's something we've talked about. The task force, I believe that Vice Chairman Feldman actually helped oversee, had made that recommendation. So that's just one of the issues that have come up. Senator Hayes, I will send you, I have a whole list. I'm glad to sit down with you and go through any of that with you as well. And finally, I just want to point out that the states that collect payroll taxes to build a fund to draw from, and there are only a few, are still to be determined as far as their solvency goes. So we truly do not have an accurate picture yet of what it takes to create a solvent fund from just payroll taxes. So that's something we've talked about in previous years. I wanted to bring that up again for you for all of these reasons. We urge an unfavorable report, but I am of course glad to work with the sponsor in the committee. Thank you.
Okay. Senator Hayes, I've got one question just based on this testimony from the retailers that I've heard about. Would you be amenable to maybe setting a date for, maybe not for enactment, but for implementation that would be maybe 6 months after or the first full calendar year after something that we would recognize as the end of the pandemic or the significant change in the pandemic circumstances were to occur. I'm just throwing that out as something, if you have a group or something, you might want to consider.
No, I appreciate that, Madam Chair. And that's something that we should definitely, talk about. I started to ask a question of, the panelists. I hear the testimony, and I'm definitely sensitive to, the pandemic. But, this is the third year the bill's been introduced.
I know.
2 years prior to, us even know that it was a pandemic, and each time, and now is not the time, right? And so I have some concerns about that. But, Kaylee, I have been, very forthcoming and straight and honest in a lot of our testimony before this committee. And so I think that's something that we can discuss as a part of the work group, indeed.
Okay. All right, thank you. Are there any other questions of this witness? Okay. Let's see. Andrew Jabin is the last one.
Perfect, thank you. Again, Chair, Vice Chair, members of the committee, for the record, Drew Jabin on behalf of the Maryland Association of Counties here in opposition to Senate Bill 211. As always, you have our written testimony. I will keep this brief. Counties would have no choice but to fund these mandated employer contributions, competing for very limited local funds against school construction, public safety, and all the other essential services. This bill does exceed any statutory length of leave, providing almost 6 months of paid leave, leaving employers in a very difficult position. As mentioned in the fiscal note on page 12, jurisdictions have cited up to $7.5 million on an annual basis for the past year, for the bill last year, sorry. And that still applies this year. For local law enforcement and agencies that provide the 24/7 coverage, this bill would create additional personnel expenses for overtime costs, and it would overburden employees. As a previous witness said, this does not appropriately balance helping employees with the economic realities that counties are facing as well as businesses. So for these reasons, MACO does request an unfavorable report. Thank you.
Okay. Are there any questions?
Yes, Madam Chair, I have a question. Drew, are there any of your counties that do not use collective bargaining agreements?
Are there any that do not currently?
Yeah,
Yes.
if you look at the text of the bill, it does provide a provision, and I would have thought that it alleviated some of the concerns. And I'm most familiar with Baltimore, not all of the other jurisdictions, but there are provisions in the bill whereas it would not override any collective bargaining agreements. And so I guess, are there situations in which there aren't bargaining agreements that exist that you're concerned about?
Yes. As far as I know, there are definitely counties that do not have collective bargaining provisions. And I'm happy to further discuss this with you.
Right, but the example that you used was law enforcement, and I thought that all of the law enforcement agencies pretty much were represented by the FOP.
I honestly do not have the answer for you at this moment. I'm taking from the fiscal note and from what I've heard from our counties. So I'm happy to look back and follow up with you, definitely.
And really, I was just curious.
No, I appreciate the question.
That would be helpful if you could help me identify that, please.
Yeah, of course.
Thank you so very much.
Okay. All right. I think that ends the testimony if there aren't further questions on that bill. And let me, before I call up the next bill, say to members, the analysts have told me they think we probably could get away with just the 45 minutes voting session tomorrow, because all we have for this week are some department bills that had no significant opposition. But following this week, we will be having a regular session of voting on Thursdays, a half hour after our bill hearings, as well as we'll keep that little bit of 45 minutes or so on Fridays in case we need it. Okay, we're going back to Senator Hayes for Senate Bill 107.
All right. Thank you, Madam Chair. This is another repeat. Senate Bill 107, Securing the Wage Act. Thank you, members of finance, for allowing me to testify today. I, along with my panel members, Jamie Contreras and Akula, as well as Doran, will be more than glad to ask any questions in a minute. Last session, again, the clock ran out as we were talking about this piece of legislation. We know that low wages of employers in heightened security areas can be a big factor in the ability to train employees. High turnover rates or experience in the field may hinder the ability of employees to respond to emergency situations. Higher wages have been implemented in other airports such as Reagan National Airport, our neighbor, as well as Dulles International Airport. Therefore, working at Maryland heightened security interest locations should be at a higher wage. Maryland heightened security interest locations include Baltimore Washington International Airport, BWI, Pennsylvania Station in Baltimore, we refer to as Penn Station, and the Port of Baltimore. The majority of workers at these sites, predominantly minorities, have worked through the COVID-19 pandemic despite at higher risk for the disease and often not having access to affordable health care every day. They risk their health and safety at work and deserve to be paid fairly. SB 107 will provide a higher wage standard for employees working in heightened security area and areas to promote the safety, security, and welfare of the state. Higher wages advance economic injustice and help economic development, in addition to covering employees' living expenses and reducing financial stress. Maryland's minimum wage increased to $11 per hour as of January 1st, 2020, and will rise to $15 in 2025. While a minimum wage increases and is a significant victory for workers, we need a higher standard for key transportation infrastructures throughout our state. Someone doesn't have their phone on mute. If they can put it on mute so we don't have any distractions, greatly appreciate it. Higher standard of key transportation infrastructure facilities to attract and maintain quality staffing to protect our public investment and maintain these sites as drivers of the state local economies. The bill ensures employees at key transportation facilities have no less than the combined service contract wage and benefit rates for a GOD 1 in an applicable county, which is currently at $14.32 per hour, plus $4.54 per hour supplement of benefits, increasing the wages of Marylanders who risk their health and safety to do their essential work, and a wise investment to the economy and security of Maryland, and the right thing to do. I also just want to remind the committee, I misspoke a little bit earlier on the previous bill. You didn't have an amendment directly in front of you, but you do have an amendment in front of you now. And it was really a mistake as we were moving quickly to get things done. There were several amendments that was agreed upon last year by those in the hospitality industry and others who did not get incorporated into this bill. So the amendment that you have in front of you, and again, Madam Chair, we'll need a work group to sort that out just to verify that a lot of those entities that we came into agreement with, but also there are some new ones. Interesting enough, we've introduced this bill for 3 years, Madam Chair. One of the entities that have really came to us for the last 2 years and said, you have to take us out of this bill, you have to take us out of this bill, has came back this year with new representation and is insisting that they be made part of the bill. So we will need some time after this hearing to sort out some of those issues, but hopefully by the end of those negotiations and conversations, we could come to a consensus around protecting our Marylanders, many of which who live in our counties, who are putting their lives on the line every day at some of these security entrances in our states, like our ports and airports. Thank you so very much, Madam Chair.
Okay, thank you. Are there any questions? Okay, hearing none. We're going to the next witness, and this is the witness who will have 5 minutes. Other witnesses will get 2.5, and that's Jamie Contreras.
I made that same mistake.
It's all right. So thanks again, Senator, and good afternoon, Committee Chair Kelly, Vice Chairman Feldman, and the rest of the committee. It's so great to see everybody, even if it's on the screen. My name is Jaime Contreras, and I'm a Vice President for SEIU 32BJ. Our union represents around 20,000 members in the DC area, including about 10,000 in Maryland. This bill, as you have heard Senator Hayes explain, we really hope that the state and the traveling public more safe by ensuring that experienced employees stick around in these jobs at heightened security locations, all while making really a good and much needed transformational change in the lives of these hardworking men and women. It will protect the traveling public and essential workers by really providing for health care benefits for essential frontline workers. The vast majority of these service workers at these facilities, whether it's Penn Station, BWI, or the port, are Black and brown and have worked through the pandemic, despite being at a higher risk for the disease and often not having access to affordable health care. And getting these jobs is not easy. People have to go through numerous security regulations. So these are really important jobs for these workers. Work at the port, work at Penn Station, it's just as intense, given that the majority of, given it is a major, especially a Baltimore port, a major shipping terminal that, where the threat of illegal activity must be constantly defended against. And we have workers there as well. This really means people have to go through extensive training for these jobs, and as they are the eyes and ears at this facility. So, and again, I think it's important to point out, and again, we mentioned this last year, that research, all throughout different facilities has really shown that higher wages and good benefits correlate to reduction in employee turnover. In security and safety roles, this is shown to have a measurable impact on the security outcomes of this facility. So, and the good thing is you're not alone in adopting some of this legislation, some of this policies. Similar policies have been adopted places like LAX, Oakland, the Port of Oakland, all 3 airports in New York, and other airports, including the 2 airports in Virginia, Dallas and Reagan National. So, SB 0107 would set a minimum wage and benefit rates based on the prevailing wage for area standards for security guards that is really set by the DOL for different jurisdictions throughout the states, but also obviously in Maryland as well. And it would also have enough money there for wages and also good benefits, healthcare benefits for these workers. So, it doesn't mean luxury for these workers, but it does mean better wage and much needed stability, especially in this time. So, in conclusion, I think restoring public confidence is crucial to getting these hubs, which are so important to our economy, back to full capacity. And we think easing access to healthcare outside of public programs for these workers will go a long way in meeting that goal. So again, on behalf of our members, I thank you for holding this hearing. And it is a pleasure to stand before you. And I'm also here for any questions. Thank you again.
Okay, are there any questions? Okay, hearing none, we're going to Akalu Tarifi.
Good afternoon. My name is Akalu Turfi. I work as a passenger service agent for a contractor, Prospect Airport Services at BWI Airport. I help people with disabilities to get to their flights in time and help them with their luggage. I walk up to 12 miles a day, sometimes even running when a passenger is late for his flight. My job is so physically exhausting that it is impossible for me to take on another extra, at least a part-time job. This means my income always falls short. In addition, I'm left with physical problems like back pain. I'm also at a higher risk of developing severe illness from COVID-19 because of my age, my high blood pressure, and diabetes. The health insurance that my employer has is so expensive that I can't afford it and must rely on Medicaid instead. I'm also struggling to pay my rent and provide for my family. I live paycheck to paycheck. The Maryland Secure Wage Act is the only remedy that would help me, my coworkers, and our families. Thank you.
Thank you. Are there any questions? Okay, if not, we're going next to Doran Brown.
Good afternoon. My name is Duran Brown. I'm a member of 32BJ SEIU, and I also work as a floor tech at BWI Airport. All day customers ask us for help, and it's our job to help them. We come into contact with so many people in the airport that puts us at risk for being exposed to COVID and bringing it home to our loved ones. And I have a stepfather who has health issues, and that's a big risk for him. No one wants to lose their loved ones. I feel we need higher wages and access affordable health care to better support our families and, you know, to be safer at work. We need and deserve to be able to keep passengers and ourselves safe and healthy. So many of us struggle to survive and pay bills, even though we add tags with important job titles of keeping the airport passengers safe and secure. Please think about the very dangerous, this is very dangerous and tough times we're all living in, and the Maryland Secure Wage Act. I thank you. Everybody stay safe.
Thank you. Mr. Brown, do you get any sick leave now?
Yes, actually I do, but I'm really here supporting some of the co-workers and a lot of the workers at the airport that I know that aren't as fortunate as myself is.
Okay, thank you.
Madam Chair,
All right.
I just
Senator
want to,
Benson.
I want to follow up on that. Are you saying to me that there are those of you who have access to medical care and there are those of you who don't?
Yes, ma'am. Yes.
Wow. Thank you.
Okay, thank you. All right, if there are not other questions of Mr. Brown, we're going next to Chair McCullough. You gotta unmute yourself.
I'm sorry, I thought I had done that. I apologize. Our concern about Senate Bill 107 is a very small one. We really are interested in avoiding conflicts in terms of which wage rates are applicable for construction work performed at one of these secure sites. Obviously, Maryland Prevailing Wage Law, the Federal Davis-Bacon Act, would apply, but Senate Bill 107 doesn't make a distinction between those rates and the Secure Maryland Wage Act rates. The Guard 1 category, which the bill sets as the standard, currently would be, including fringes, $18.86 per hour. Now, there are no prevailing wage rates or Davis-Bacon wage rates for construction in Baltimore City or Anne Arundel County that are less than that amount. So I think it would be prudent simply to exclude construction from the ambit of the bill with the knowledge that the wage rates being paid by construction are more than those that would be set under Senate Bill 107. I'll be happy to answer any questions.
Okay, are there any questions?
Not a question, Madam Chair, but, and I apologize, Mr. McCullough. We will get you the amendments, what I think will address your issue. And I apologize, you couldn't get them in advance.
Okay.
That's very gracious, Senator, and I appreciate that on behalf of my members.
Thank you very much. Now we're going to unfavorables. David Richardson.
Yes, hello. How's everybody? Hope everyone can hear me. I won't be long, but I'm with Southwest Airlines, testified last year. And I just want to hit a couple top line points. One, just with the pandemic. So our industry, the travel and tourism industry, including the airlines, have been severely impacted each and every day. Southwest Airlines, since around March 1st, we lose about $10 to $15 million per day. In all net, in 2020, we lost roughly $3.4 billion. It's the first loss we have had since 1972. And as you can imagine, $3.4 billion is a lot of money, including for our company. We have slashed our budget by $8 billion this year. But we have not touched payroll. We have not touched our employees' benefits, healthcare, retirement. We have roughly 5,000 employees based in Maryland. And I would guess we're the largest employer impacted by this bill. Our roughly 5,000 employees are all union. They have collective bargaining agreements. None of them are represented by the SEIU. So we're the largest employer. We're brought into this legislation. But again, to my knowledge, our unions are not asking for this. They have health care. We have a great company, great corporate culture. And I just think it really is. I'm very proud that Southwest has able to at least manage this pandemic without taking away pay or benefits for our employees. And so I leave you to that data point. But anything, in this time, this bill would have a major cost impact on us at the wrong time. And I would say all employers at BWI Marshall. Again, this is the worst crisis ever in the travel and tourism industry. And for the airlines, our 50 years, like I said, we haven't had a loss since 1972, but we still have kept pay, we've still kept healthcare, we've still kept our 401k program untouched. And then with regard to the legislation, I haven't seen the amendments. I just heard about the amendments, but heck, if you guys are carving out entities, then I think you should consider carving out Southwest and or at least have respect for our collective bargaining agreements. Our unions are national unions. They're very sophisticated. They're not shoulders. They know how to bargain. And so, again, I just don't want, this legislation would upset those CBAs. And I guess the last, just for Southwest, we have a great partnership here at Maryland, 27 years. And to date, after 27 years, this is the only bill that Southwest has come to the legislature to testify about. And I think it illustrates our concerns about this legislation. And then
you're a bit over your 2.5.
Oh, okay, I'm sorry, I didn't want to clock, but I'll stop. Thank you very much.
Okay. And now, Kelly, are there any questions of this witness?
Yes, ma'am. I had a quick question, Madam Chair, because I was confused by David's testimony. He first testified that Southwest shouldn't be a part of it because of the impact on Southwest. Then he testified on behalf of everybody, all businesses. But then he came back and said, if you just take Southwest out, we might be happy. So just to get clarity on what your concern is about the legislation for the committee would be really, really helpful.
Oh, sure thing. So I'm here on behalf of Southwest Airlines. So that's who I'm speaking for.
Right. So if Southwest was taken out of the bill, you would be happy. You weren't testifying on behalf of all businesses?
Correct. We're part of the same ecosystem. So it is an ecosystem. I just in the sense it's an economic ecosystem. So
right.
Port of Baltimore, if there's no planes, there's no jobs. So
I got you. We running out of time, and I just had one more question.
Okay, I understand. I'll stop.
You said you would just hope the legislation would respect the other bargaining unit you have, you do realize this is for contractual employees, correct?
Oh, and I understand that the legislation is very broad.
Right, and so contractual employees would not be covered by any bargaining unit, correct?
I'm not following your question, sir.
If you're a contractual employee, right,
Yes.
you would not be represented by any bargaining unit. What your testimony to this committee was that we should not be interfering in any bargaining agreement that you already have, but we're talking about those individuals that are not covered by a bargaining unit.
Under my reading of this legislation, it would impact and basically amend or void our collective bargaining agreements with our employees.
No, that's not
That's
true.
the version I saw as filed.
David, let's just follow up later. I don't want to hold the entire committee
Okay,
up,
I have it right here.
but your testimony just doesn't match what it is. So I'll follow up with you.
Okay, and just one last thing.
David, you done? You finished? Thank you.
Okay, okay.
I appreciate it.
Okay.
Thanks.
Okay, thank you. Kaylee Locklear.
Madam Chair, honorable members of the committee, Kaylee Locklear here on behalf of the Maryland Retailers Association. The sponsor in the beginning of his testimony actually addressed what our issue is, as long as the amendments are adopted that take retail and restaurants out in these locations, and we're fine with the legislation. So those are my only comments, and thank the committee.
Thank you. Melvin Thompson.
No. Oh, he's not. No, he's not. Nope, he just came in. He's here.
Is Melvin Thompson available?
Yeah, he's got. Adjusting his audio.
Okay, that appears to end the testimony on this bill.
I'm waiting for Melvin. He's taking it.
If you don't show, and that'll be known that if
He's in
you.
there. It's just the audio isn't connecting. There we go.
All right, tell me.
And there he is.
Okay, Melvin Thompson, you have 2.5 minutes.
Thank you very much, Madam Chair, members of the committee. I'm Melvin Thompson. I represent the Restaurant Association of Maryland, and I apologize because I'm in the Economic Matters Committee simultaneously. It's a little difficult going back and forth. But we did sign up opposed to this legislation, but I just wanted the committee to know that we've already had conversations with Senator Hayes and his staff, and it was not his intention for this year's bill to also include food service and retail employees. And so we will be reconsidering our position. I do apologize. Reconsidering our position and withdrawing our opposition upon the adoption of Senator Hayes's amendment to exclude food service and retail workers. Thank you very much.
Okay, thank you very much. Is there any question? Okay, and that ends the testimony on Senate Bill 107. We're going next to Senate Bill 95, Senator Kramer. Public utilities, investor-owned utilities, prevailing wage.
Yes, ma'am. Thank you for that. Members of the committee, Ben Kramer here to introduce Senate Bill 95. And I will preface my comments by saying, committee, thank you. We took good action on this legislation last session. We passed the bill overwhelmingly in committee. And unfortunately, the clock ran out before we could get it across the finish line. So, pardon me, I hope that we will do the same thing, Madam Chair. Hopefully we'll get it up on a voting list early this session so that the clock doesn't run out on it again. Quite simply, the bill provides that a gas or electric utility that is investor owned, and Senator Hershey and I had some discussion about this last year because it's investor-owned utilities that is contracting out work for underground infrastructure. It's very specific. If the utility is contracting out, an investor-owned utility is contracting out work for underground infrastructure it requires that utility to ensure that a prevailing wage is being paid. The goal here is to stop the race to the bottom. Utilities used to do lots of work in-house. Now they have stopped doing that. They've stopped paying employees, so they're contracting out the work. And we want to ensure that we don't get into a race to the bottom to pay the least amount for the work, because this is significant public safety related work that is being done, this underground infrastructure. So the bill, again, simply provides investor-owned utility, contracting out work for underground infrastructure, pays a prevailing wage. Committee, thank you. Again, I appreciate the fact that the committee saw fit last year to pass the bill, and I hope that we'll take a similar action again this year. Thank you, Madam Chair.
Thank you. We're going next to Nick Benetti. And this, you have 5 minutes and other witnesses will have 2.5.
Thank you, Madam Chair. Hopefully I won't be that long. I think Senator Kramer did a pretty good job of describing the merits of the bill. Chairwoman Kelly and members of the committee, thank you for allowing me to be here today. My name is Rick Benetti. I'm representing Lyona's Baltimore, Washington District Council. We represent more than 7,400 members in the Maryland, DC, and Virginia region, 2/3 of whom are Maryland residents and are in support of Senate Bill 95. Like Senator Kramer said, this bill passed the committee and then passed second reader on the Senate floor last year before we ran out of time. I would also point out that as the fiscal note states, there will be little to no impact on the ratepayers with requiring regulated utilities to pay prevailing wage on underground work. Today, investor-owned utility companies are contracting out large portions of their construction work. BGE, for example, has close to 1,000 contracted out workers maintaining its infrastructure. And virtually all of Washington Gas pipeline replacement projects are performed by contractors. Given how important the utilities are to Maryland's economy, the issue here is that the utility regulation in the state has not necessarily kept pace with this trend, especially given the state's priority that all utilities continually modernize and keep safe their infrastructure. Senate Bill 95 addresses this by extending the prevailing wage already paid to workers on public infrastructure like roads, bridges, sewers, and tunnels to all utility projects that are in the ground. The shift to outsourced workforces utilized by utility companies is not unique to Maryland. But unlike Maryland, other states have developed some best practices to ensure that there isn't any compromise on the quality, safety, and reliability of this work on their state's critical utility infrastructure. In New Jersey, for example, BGE and Pepco's sister utility, Atlantic City Electric Company, is #1 required to use contractors employing workers who have successfully completed OSHA certified training, and 2, that those employees are paid the prevailing rate for their craft. New York City requires prevailing wage on all street excavations. And since most utility infrastructure is buried under public streets, this rule assures that the high construction standards are maintained regardless of whether it's a government infrastructure project or one privately financed through a public utility. In Pennsylvania, where municipalities own and operate their own utilities, like Philadelphia Gas and Electric, construction workers are paid prevailing wage. Even in Maryland, there's already precedent for prevailing wage on utility work. The Washington's Suburban Sanitary Commission has required contractors to pay their workers on their projects prevailing wage since 2014. Like the senator said, prevailing wage on public infrastructure helps remove the downward pressure on wages, and also importantly incentivizes contractors to invest in a pipeline of skilled labor through apprenticeships. So because the fringe within prevailing wage helps in part fund apprenticeships, you have labor management agreements where the contractor and the labor organization are both contributing to making sure that there is the most modern and up-to-date apprenticeship program possible in whatever the craft is. So we just feel since the Maryland Public Service Commission's adoption of multi-year rate making pushes the issue of wages to the forefront, because utilities now have the opportunity to set rates for several years at a time. And this provides utility companies and their shareholders with some regulatory and short-term profit certainty. The question is, though, what benefits will Maryland residents get out of it? The state should guarantee that its citizens are receiving the most modern, reliable, and safe utility infrastructure possible, built by a pipeline of highly skilled Maryland workers, made possible by a prevailing wage floor. So BWLDC urges a favorable report on Senate Bill 95. Thank you.
Thank you. Are there any questions? All right. If not, what'd you say? Senator Hershey.
Thank you, Madam Chair. Either for the bill sponsor or for Rick. My concern is we're not seeing any opposition from the big IOUs, the excellent IOUs, nothing in here from Pepco or BGE, Delmarva, nothing from Washington Gas. I'm assuming they're all okay with this because they probably already pay those types of prevailing wages, and obviously any of those costs are already baked into the rates and they get recovery for that. So this really would just affect the smaller investor-owned utilities. Is that correct then?
Thank you for the question, Senator, and thank you for bringing that up. I neglected to mention that BGE, Pepco, and Washington Gas are unopposed to this bill.
Right.
I don't know, what the rates are for contractors. I could probably get you some information about what any of our contractors who are signatory to that do work for any of those utilities, what their wages are. I just don't know. But the cost would be negligible in terms of an increase. Even if you
define negligible, excuse me, just negligible in the ratepayer impact, or negligible in the overall cost of the projects. What do you mean by that?
I think overall the negligible in the overall cost of the project. So, like the fiscal report says, it would raise project costs by 2 to 5%. It's actually labor costs as a part of that project cost by 2 to 5%. But you're getting a better skilled, better trained workforce. So you make that up in efficiencies down the line. Also, costs, including labor costs for utilities, whether they're big or small, are capitalized. So they are guaranteed a certain amount of return.
A rate of return on that.
Based on that. So
that's probably why they're not here in opposition to that, because they get a rate of return. If it doesn't increase the project cost, they're not really concerned about that, because their rate of return goes up as a result of that. Again, so we're not seeing the big companies out there. I'm concerned more about, I did see Columbia Gas has a letter of opposition. I know over here on the Eastern Shore, Chesapeake Utilities, we're very fortunate. The Board of Public Works just approved a pipeline project for the Lower Eastern Shore, which is going to bring a massive amount of economic development to one of the poorer counties that we've had. So we're very happy that that's going to happen. But one of the issues is there's a contract in place with UMES to be an off-taker of the renewable natural gas that's in that pipeline. Would this affect contracts that are already in place? Again, they already have that off-taker contract. This could, especially on the Eastern Shore, drive up project costs and potentially make the deal where we'd have to go back to UMES and potentially renegotiate with that?
I don't think it would raise. I don't think it would raise project costs as we've already talked about. The bill takes.
Just let me ask real quick. I mean, if you keep saying that it doesn't raise project costs, then I'd have to go back and say, well, what's the benefit of the bill, right? I mean, if you're saying that project costs aren't going to go up, then why are we even doing this?
Well, if they go up, it'll be negligible. We're doing this because if the state, the state has obviously made a policy decision to ensure that its public infrastructure is built by the best skilled workforce possible.
And this doesn't address the best skilled force employees. I mean, where does this address that?
Prevailing wage helps ensure that workforce it would be a highly skilled and highly trained workforce.
We don't know that.
It helps building the cost for apprenticeship training. Whether you're an apprentice.
That might be something that you see over in the more urban areas where that's all you're focused on. But I can assure you there are very highly qualified contractors over here in the Eastern Shore, and you're doing the same thing that we heard earlier and continuing to denigrate those contractors just because you're representing the union. So that's not necessarily true. So I want to go back to the fact that if the costs aren't going to go up, why is the bill necessary?
All right, at this point, if I may have the opportunity to jump in, and no one is denigrating non-union workers at this bill hearing or under this legislation. Quite frankly, as a proportion of the work, I think is what we are seeing is that if a skilled labor force is being paid the appropriate wages that a skilled labor force demands, then we're not going to be seeing dramatic increases in the costs of these products. So with regard to your question, what about this project? Is the price going to skyrocket and jump? Well, unless they have underbid the work in an effort to minimize the cost for the labor, then the answer is no. If the projects were bid minimizing the cost of the labor, which then does drive down performance, and I would proffer to you that's just common sense, then that's a good reason for this legislation, because we don't want an inferior work product on this underground infrastructure. So
I would agree, but again, yeah, I would agree. But again, we go back to this regionalized cost of work, and a company that's bidding for this type of work on the Eastern Shore may not be paying the same type of rates that are seen in Baltimore or the metropolitan areas on the Western Shore. But that certainly doesn't mean that those workers are any less skilled than what may be over in Baltimore or Washington as well. Keep in mind, anybody can bid into a project that requires prevailing wage. You just have to increase the employees' salaries or rates as a result of this. It doesn't necessarily, if you're so concerned about the quality of the employees or the contractors, all that's happening is that you have to pay them more. It doesn't.
And the prevailing wage rate paid in different parts of the state is adjusted to account for different parts of the state. So yes, Baltimore City may be one thing, the Eastern Shore is something different. So it doesn't account for the prevailing wage in different areas and different regions.
A non-union shop that wanted to bid into this type of work would just have to raise the rate that they pay their current employees to meet the obligations of this legislation. Is that right?
If in fact they're not doing it now, and no one's saying that they may not.
Right.
But legislation will require that, yes,
the same employee would get this.
Right. They may be paying it, and God bless them, that's great. If they're not, we're saying, yes, this is the minimum standard, and here is the logic and the rationale for it.
Okay. Could I ask, Madam Chair, just one more thing if I could. This would obviously affect any type of stride projects, right? I mean, this is one of the things underlying gas utilities. Stride is paid for by the ratepayers. We've got a line item on the bill that specifically says how much goes into it. If we're able to start proving that or showing that this type of prevailing wage requirements dramatically or more than negligibly increase the rate, increase the project cost, then we're going back and saying, we're asking the ratepayers, in a sense, they'll be getting less projects and less safety done for the amount of work that's going in for the money that they're putting in. Are you guys open to us coming back and showing, or different companies coming back and showing that prevailing wage is making project costs go up more than just the 2 or 5% that you are that was quoted by Rick?
Well, at this point, it's premature to go down that path, and there are a lot of other implications for our utilities, quite frankly, as to what might be driving their costs well beyond this. And if there were at some point in time a greater analysis, which I'm assuming they provide to the Public Service Commission now when they go in for rate adjustments, I'm guessing they are already getting into that detail. So if that were an issue, I'm confident we would know it, and the utilities would have been here today to say, wait a minute, we have concerns, but clearly they are not. And again, I think the goal here, and it has nothing to do with whether a shop is union or not, it's let's just make sure we don't have a race to the bottom of the bidding process and minimize what labor will be paid to perform this critical infrastructure work. And it's about public safety. That's what this is about.
Okay. Thank you, Madam Chair. Thank you, Senator.
Yeah.
Thank you.
Mr. Sponsor, let me ask you one question. Since we have cited already the 3 large investor-owned utilities, and they are not here testifying, are there other smaller utilities in Maryland that are investor-owned? I'm aware of co-ops and so on, but do we have some other investor-owned utilities here other than BGE, Washington Gas, and
Exelon? That's, yeah.
But BGE is a subsidiary of Exelon.
Of Exelon, and so is
yeah. So maybe there isn't anybody that.
Madam Chair, I think we're going to see Columbia Gas has testimony on this. They are not IOU, but certainly not under the Washington Gas and Electric again.
But is Columbia investor owned?
I believe that it is.
Columbia is part of one of the largest national utility entities.
So it's a subsidiary
that exists. It's a subsidiary.
Right.
So it's a subsidiary of a huge entity. Correct.
Right.
Okay.
Yeah, and Madam Chair, if I could add with regard to Columbia Gas, they're already used to using contractors that are paying prevailing rates on either their projects or lots of other projects that they work on. So I think we're talking about, the bill would just simply ensure that they're continuing their practice and extend, the prevailing wage to the small amount of work that their contractors aren't already, that their contractors doing for them, that they're not already paying prevailing rate. And in fact, Columbia Gas, go ahead, I'm sorry.
If we were to clarify that this applies to investor-owned utilities and subsidiaries of investor-owned utilities, I think we would solve the problem because we're not hurting other smaller independents or co-ops and things like that, right?
Well, yeah, it applies to, go ahead, Senator. Sorry.
I was going to say the bill does specify investor-owned, Madam Chair.
Okay, but
so we know it's not
questions about subsidiaries of investor-owns, and they would be included because they are part of the investor-owned, right? But maybe we could just clarify that. I don't know. Anyway, that was my question.
Thank you.
Okay. Are there any other questions? Okay. And who do we hear from next? All right, Dan Lipschultz.
Thank you, Madam Chair. My name is Dan Lipschultz. I'm a founder of Lipschultz Energy Consulting. I've worked in the utility and energy industry for about 30 years now as a ratepayer advocate with the Minnesota Attorney General's office, as a utility lawyer representing utilities, and most recently for 6 years as a member and vice chair of the Minnesota Public Utilities Commission. I've been involved in hundreds of utility cases, dozens and dozens of rate cases and infrastructure proceedings over the years as an advocate, as a ratepayer advocate, and as a regulator. And that's the experience I bring to bear here. I was retained by LIUNA to take a look at this bill and look specifically at the potential impacts the bill might have on utility customers, especially with respect to residential rates. And you have a white paper that I've submitted, and you have my written testimony. So I want to really be brief and focus in briefly on 3 findings, and then I'd be happy to take any questions. First of all, this bill is really a natural and logical extension of your current prevailing wage law, because it applies to infrastructure that exists for public use or benefit, which is precisely how the Department of Legislative Services describes the purpose of your existing sort of prevailing wage law. And secondly, the bill furthers the interest, public interest in safe and reliable utility service by helping ensure that you have an experienced, highly trained, and I think more importantly, a stable workforce over time that can do this really complex, difficult work that has all sorts of safety and reliability implications. Because again, we're talking about public infrastructure and public rights of way that delivers an essential utility service that all Marylanders depend on, basically to heat their homes and their water on cold winter days. You can't do without it. It's maybe perhaps the most important service that any of us receive. And then finally, I'd say that, and this is really important, and you've talked a little bit about it already, this bill is not going to increase costs, and certainly is highly unlikely it's going to increase residential rates. In my research, the overwhelming majority of peer-reviewed studies of the impact that prevailing wage has on cost shows that it has almost no cost. Upward cost increase has very little impact on the cost of projects. And that's really because you get a more efficient workforce, you have fewer redos, you have fewer stoppages, you just get a more efficient sort of project than you would otherwise get. That's what the studies show. 82% of the peer-reviewed studies show that. But I think even more importantly in this context, even if project costs increase as a result of prevailing wage, it's highly unlikely that those project cost increases will get passed on in any significant degree to the ratepayer through higher residential rates. And that's again because of the way the rate setting process works. No rate increase goes into effect without approval by the Maryland Public Service Commission, and that's done through an exhaustive quasi-judicial proceeding with layers of analysis, countless inputs, all sorts of adjustments, and a lot of judgment that's brought to bear by the regulator with a lot of input from experts and stakeholders, both inside and outside the agency. And when you kind of put all of that together, even if you have a cost increase, let's say, for example, in labor resulting from prevailing wage, that cost increase is easily offset by any number of other factors, disallowing certain costs, accounting adjustments, a lower rate of return on the rate base of the utility.
Okay,
I mean,
we're going kind of long just to answer these questions. In some cases, we're longer than the original time we were given.
Okay. I can stop there, and I'd be happy to answer any questions.
All right. Are there any other questions? Okay. Now we're going to Raymond Diaz.
Hello, can anybody hear me okay?
Yes.
Good afternoon. Thank you, Chairwoman Kelly and the members of the Senate Finance Committee. My name is Raymond Diaz, and I'm one of the about 3,000 members of LIUNA's Local 11, working throughout the DMV region, who are in support of Senate Bill 95. Through Maryland's prevailing wage, I found a pathway into the middle class for me and my family. My family has benefited because this state has made the clear choice to leverage funding for infrastructure construction in ways that help contractors pay for apprenticeship training, pay family sustaining wages, and provide good benefits. I'm the prime example of the positive impacts prevailing wage on Maryland's economy. Like me, about 1,600 Local 11 members live in Maryland and are on the job every day. Many of us pay Maryland property taxes. All of us pay income and sales taxes in Maryland. Our members contribute to their local tax base because they work on essential public construction projects that pay prevailing wage. Senate Bill 95 is a simple extension of Maryland's prevailing wage to critical energy infrastructure the public depends on every single day, as was mentioned. National research has shown again and again that prevailing wage laws help local workers like myself attain higher wage jobs with better family health care coverage, for example. Research also shows these laws help bolster local economies and reduce drag on state-managed social safety nets. I conclude with this. Local 11 works with over 100 local contractors in DC, Maryland, and Virginia that do heavy infrastructure, as well as public utility. This bill will help these contractors hire more Marylanders like myself to safely build and maintain the state's utility infrastructure. I urge you to support Senate Bill 95. Thank you.
Thank you. And then our final witness is Jamai Carilla.
Good afternoon, Chairwoman Kelly and the members of the Senate Finance Committee. My name is Jamie Carilla. I was asked to testify as the owner of Carilla Earthworks, WBE and MBE small business contractor based in Prince George's County, Maryland. We specialize in stormwater, utilities, and site development services for commercial, industrial, environmental, and residential projects throughout Maryland. Carilla Earthworks is in support of Senate Bill 95. Most state public infrastructure work already pays prevailing wage. We believe prevailing wage helps companies like Carilla Earthworks partner with organizations like LIUNA to build a strong and local construction workforce, one that is paid decent wages with health care and pension benefits. We are proud to be a small company that helps create middle-class jobs and invests in apprenticeship training for construction workers in Maryland. Prevailing wage helps small companies like ours compete on a level playing field against larger companies because it creates a standard floor for wages, in our case, workers specializing in utility work. Currently, 50% of our workforce are Prince George's County residents. As a general contractor, we are involved in the Prince George's County Clean Water Partnership. Our firm was in the first cohort of a mentor protege program included in the CWP. We started with just 2 employees, and today we employ 12. We've also taken advantage of the built-in local hiring incentives by focusing on hiring local county residents. And with their help, we have performed over $8 million worth of stormwater infrastructure work throughout the county. The value of prevailing wage is obvious. It promotes success of local companies like ours, employment growth for local construction workers, and helps build Maryland's economy. Because it's a natural extension of public works, we believe the same value will be built into the work done by Maryland's public utilities through this bill. And we urge your favorable support of Senate Bill 95. Thank you.
Thank you. Are there any questions? Okay. If not, I believe that ends the testimony on Senate Bill 95. Okay, and we're going next to Senator Kramer, Senate Bill 273. And Senator Kramer, you're on.
Thank you, Madam Chair. I appreciate that. Madam Chair, Mr. Vice Chair, members of the committee. Pardon me, Ben Kramer here to introduce Senate Bill 273. Committee, before we had the coronavirus pandemic, our nation was being overwhelmed with a pandemic of children getting hooked on vaping products, an issue that dominated a lot of discussion we were having prior to the coronavirus pandemic. Last year, this time, I introduced a bill that would have prohibited flavored vaping tobaccos in the Maryland, products in the Maryland market. At the conclusion of the bill hearing on that and in subsequent conversation with the members of this committee, I had the impression that the committee was more inclined to support significant regulations of the industry rather than a flat out prohibition. And the goal being get these products out of the hands of our children. So it is in that vein that I worked during the interim, using as a basis the work product of the comptroller's task force that took place during our legislative session last year, and also of which I was a member, as the basis for the legislation that is before you today. It's interesting. There is nobody that supports this legislation. It either goes too far for some or not far enough for others, which leads me to believe that I have hit just the right balance on this legislation, Madam Chair, because nobody's gonna be totally satisfied. But I'll go through with the committee what the bill does, and then committee, it's going to be up to you all to decide. Either we act and we regulate this industry and we get serious about the regulation, or we allow for the proliferation of this product in our communities and in our schools, and or just totally prohibit. We heard legislation earlier today that creates that prohibition. And Madam Chair, if that's the will of the committee, I'm on board. If that's the direction this committee chooses to take. My offering this legislation to regulate the industry is not an acknowledgement on my part that I support the industry or what they are doing, or that I believe the product is right for purposes of cessation from, traditional tobacco products. But what I think we are accomplishing with this bill is a very thoughtful and practical mechanism by which to get this product out of the hands of children, still allow adults who choose to use vaping products to be able to do that. And with that, here is what the bill provides in a synopsis. Number one, it would restrict vaping products to vape shop vendors, which under the bill is a license that would be granted to those who want to operate a retail store. So if you want to buy a vaping product now, you'll have to go to a vape shop vendor. It would take vaping products out of the convenience stores and the gas stations. So they're going to be here to oppose the bill for that reason. But studies have also indicated that the majority of access to our children, our youth, has come through these sources. So my sentiment is that if we're going to get serious about controlling the product, it doesn't need to be every gas station and every convenience store across the state. Let's make sure we're putting this product into a controlled environment. So that's number one. You can buy them in vape shops. Number two, it prohibits the sale of any of the disposable, what are referred to as sealed and pre-filled vape products, including menthol. Those are off the market. None of these disposable, like Juuls, of the pre-filled flavored products, including menthol. It does allow for flavored liquids as a cartridge or a pod to be used in a vaping device. This we heard last year from the testimony from the vaping industry is the lifeblood of their ability to thrive and to succeed. So we get rid of the disposables, but we allow the refillables, the little, you know, things that you buy to put into a vaping device. That will continue, except only in a vape shop, nowhere else. It would require that the industry provide information about the components of both the product and the ingredients of what goes into them to our public health officials. We need to get away from this double secret probation. Nobody can know the secret sauce of what's going into our vape products. We need to know what's going into those products and what people are taking in to their bodies. So the bill will require that information be provided if they want to sell in the Maryland marketplace. It prohibits anyone under the age of 21 from entering a vape shop. So you can't even walk in the door unless you're 21. It also requires that before the sale can be completed in a vape shop, that a government issued ID must be scanned to show that the individual is 21 years of age or older. If they're not willing to install that equipment to ensure the age verification, they can't be selling vaping products. This is part of the logic for this is that some of the pushback about only having this in vape stores and you have to be 21 is that, well, the vape stores would still sell to people under 21. Well, under this bill, before that transaction can be completed, they have to have equipment that doesn't allow the transaction to take place without that scanned government ID. There's a simple little piece in here that requires a fee to go to local health departments so that they can do the enforcement, because that's where the enforcement's going to come from. Local health departments making sure these vape shops are in compliance. So there's a nominal fee that would be applied and go to local health departments. It would also permit our Maryland State Health Department, as well as our new executive director of our Alcohol and Tobacco Commission, to verify the ingredients that they're told are in these products, should they choose to do so. It doesn't require that they have to investigate the ingredients, but if they have questions about, is this legit? Are we getting, accurate information? And they want to periodically check on it and make sure the chemicals are complying with what's been reported. They have the authority to do so. It would add vaping products to our Maryland Clean Indoor Air Quality Act. So where we have limitations now for where you can or cannot smoke traditional tobacco products, it would also apply to the vaping products. It would prohibit the sale, and this was a major piece of the task force recommendation last year. It would prohibit the sale of the electronic smoking devices through the mail or the internet. The only place you'll be able to get these products in the state of Maryland is from a licensed vaping shop. Finally, it limits the vape shops to selling vaping products and vaping products only. And the logic here is that we're taking it out of all the gas stations and the convenience stores. You vape shops now have the exclusive right to sell these products, but we don't want you competing with the gas stations and the convenience stores and the myriad of other products that they are selling. So with that committee, that is what the bill does. It would put in place the most significant regulations on the industry in our nation. I would proffer to the committee that for all of those that we heard from last year at the bill hearing that want access as adults to their vaping products, they will still have that access. But we will make significant inroads in preventing this product from getting to our children, from getting into our high schools, from getting into our middle schools. And I think that is first and foremost where we want to be. So once again, committee, nobody supports this bill. But I think our committee should give it very serious consideration because it's the right thing to do. And if we're going to be serious about addressing the pandemic of vaping, with our children, let's get it done. With that, Madam Chair, I thank you. Committee, I welcome any questions or comments, and thanks for your time.
Okay, thank you. So the first witness will be, well, each of your witnesses, since nobody stood out as a man, you had nobody that was simply favorable, we're going to give everybody 2.5 minutes each. And so we'll start with Neil Karhamis.
Good afternoon, Chair Kelly and members of the committee. Thank you for your time today. My name is Karhamis, and I'm here on behalf of a coalition called Faith and Community Against Flavored Tobacco, which is comprised of a large and diverse group of public health advocates, providers, parents, and even kids who are working to end the flavored tobacco epidemic in Maryland. I want to start by thanking Senator Kramer for putting in this bill. I hear him that nobody supports it, but thank you for bringing it up. We share a mutual goal, and that's to turn around the fact that 1 in 4 high schoolers are currently using e-cigarettes that come in 15,000 flavors, including menthol. We also know that kids are using other flavored tobacco products like cigarillos, snuff, and others. In fact, 80% of those kids that have tried a tobacco product started with a flavored product. We all know the significant problems these products cause to public health, with 7,500 people dying each year in Maryland with associated illnesses, the massive costs of the system broadly, and the disproportionate effects of these products on minority and low-income communities. You heard plenty of that earlier today, so I'm not going to rehash all of it. But like Senator Kramer said, there are some folks that believe this bill doesn't go far enough, and I'm one of those people. Even with the current age restrictions, these products and becoming addicted. I actually had a workshop with youth activists about a week ago. There's something genuinely wonderful about speaking with kids about making good public policy. They separate the politics and they focus only on what's doing right. I asked these kids aged 12 to 17, how many of their friends are currently vaping? And I've studied this issue a lot, and the data says 1 in 4, but a lot of these kids said roughly half of their friends are using vape products. And they said it's because they don't taste like vegetables. They taste sweet, they're easy to inhale. We know that the Legislative Black Caucus, the Attorney General, the Comptroller, and over 50 organizations, as well as faith and community leaders, all support prohibiting these products. We also know these products aren't approved by the FDA or the CDC as a cessation device. They hook kids, and they ensure a lifelong struggle with tobacco addiction. And though this bill attempts to regulate the sale of these products, it's clear that they will ultimately get to the kids through their older friends, family, or acquaintances. Otherwise, how are 1 in 4 using it? It just doesn't make sense. So this isn't the sort of issue we should be seeking a compromise on. It really comes down to protecting our public's health over protecting big tobacco's profits. We really should prohibit these products entirely. I encourage an amended version of this bill that would remove these toxic and addictive products entirely. Thank you for your time.
Thank you. Are there questions? Okay, we're going to Neil Kahanis. Oh, I'm sorry, to Candace Gott.
Good afternoon, Madam Chair and the rest of the committee, and thank you, Senator Kramer, for introducing this legislation as well. My name is Candace Gott, and I'm not big tobacco. I'm a small business owner in the community and a member of the Maryland Vapor Alliance. I became addicted to cigarettes at the age of 15. To fit in and look cool in front of my friends, I developed a nasty habit. I cannot tell you what type of cigarettes I started using because I used whatever was available to me. If you take flavors away from responsible adults who use them to refrain from smoking, teens will continue to experiment with what is available to them, flavored or not. If flavors are the reason why, then why did I get hooked? Data from the FDA shows that vape shops in Maryland are doing their part in not selling to people who are underage. Maryland vape shops continue to pass compliance checks while convenience stores and other retail establishments that are not age gated continue to fail compliance checks. Per the CDC, the item teens are experimenting with the most is big tobacco products such as Juul and Vuse. These products are sold in convenience stores and are sold in 5% nicotine. The typical nicotine content sold in a vape shop is less than 1%, and these are used in open systems. High nicotine vapes are the problem. The really bad news is if flavors are banned, vape shops will cease to exist. This means the only remaining products would be high nicotine, big tobacco products sold at convenience stores. There would be no option for lowering your nicotine content over time. Adults using a nicotine level of less than 1% found in vape shops will be forced to use the 5% nicotine level. This would send some back to cigarettes, but many more to the black market or a different state to buy their flavored products from a vape shop. This is why we support the bill with proposed amendments. We believe age-gated, dedicated vape shops will take extra care in making sure a valid ID is scanned and that a straw purchase isn't happening. This bill with the proposed amendments will stop a black market from forming and it will stop adults from going back to a product that kills 500,000 each year. If we do not protect flavors in vape shops, the only options for consumers is high nicotine tobacco products sold in convenience stores or finding products on the black market. And I'll remind you, there is no quality control or taxes collected on the black market. This bill addresses many of the sensible and fair regulations that Maryland vape shop owners have been asking for since big tobacco entered our industry and made it into a big circus. The bill helps small business in a time when businesses are already struggling. There are studies coming out every day that shows that vaping is less harmful than traditional cigarettes, and that flavors are the driving incentive that help adults kick this habit. I'm urging Maryland lawmakers to work with responsible vape shop owners in the Maryland Vapor Alliance. My business is my livelihood and it helps people. We want to work with advocates, we want to work with lawmakers, and we want to help you pass fair and sensible regulation that keeps the good players in business. Thank you.
Thank you. Are there any questions? All right, we're going next to Donna Bartlett.
Good afternoon. I thank you for allowing me to testify today, and thank you, Senator Kramer, for putting this bill on the table. I'm Donna Bartlett, and I'm a concerned mom and a parent volunteer for Parents Against Vaping. On its face, the spirit of SB 273 might seem to be a good one, since it prohibits the sale of flavored, sealed vape products, and it seeks to regulate vape shops to ensure that the flavored products are kept out of the hands of our children. However, it does not go far enough, and it will not protect our kids. Unless all flavored products are removed from the market, kids will continue to get their hands on them. We cannot support this bill unless it is amended to end the sale of all flavored products, including menthol. Let me share with you my son's vaping nightmare. A year ago, my son, an honor roll student and dual sports varsity athlete, tried vaping flavored nicotine for the first time. He said it tasted great. Cherry and menthol were his favorite. Yes, menthol is a flavor, and in fact, it is the most popular one. The sweet odor was a sign, along with so many others, like the flash drives that were vape devices, stripped USB cords, empty pods, empty cartridges, e-juice containers. He was using it all, filling, refilling, and or replacing. It was not until months later when my son had now been vaping for 3 months, 5 times a day. How did this happen when he knew the dangers? How did this happen when the age limit was over 21? But it did, and now he can't stop. The emotional effects are devastating. His mood swings, panic attacks, lack of motivation, his depression, his lies, his desperation, it's all there. And sadly, the physical effects of vaping are just as great. Jacob, who's a starter player, was one who played the entire game, could no longer do that because my son couldn't breathe. No parent should ever have to watch their child gasp for breath like he did on a field that he once dominated. I do not want any other child to have to deal with this addiction that he is still dealing with today. People need to understand the severe negative effects of vaping, both mentally and physically. These flavors are drawing our kids into vaping. The extremely high levels of nicotine addicts them and keeps them coming back for more. This epidemic is not going away if our kids are able to obtain nicotine products, and that is exactly what is happening. The age restriction of 21 is not always enforced. The only way to end this is to remove all flavored products, including menthol. I thank you for your time today.
Thank you very much. Are there any questions? Okay, we're going to Isaac Mayer.
Madam Chair, members of the committee, Isaac Meyer, Compass Government Relations, on behalf of the Maryland Vapor Alliance, here favor with amendments on this legislation. First off, I do want to thank Senator Kramer for bringing forward this legislation. As I mentioned in the hearing earlier today, the Maryland Vapor Alliance could have easily looked at SB 177 and just said, we want an exemption for vape shops. We could have easily said that and lobbied for that. However, we saw Senator Kramer's bill, and we believe there are a lot of good provisions in here that address new and creative ways to regulate the industry, as well as create additional transparency. I think one of the most important things in the amendments we offered is the first one on page 2 of the Maryland Vapor Alliance's testimony. If it's the will of the committee to pass this legislation, we have 5 or 6 pages of amendments, but the most important one is on page 2. It says that if, and this one we asked for, it says that if a vapor shop sells to a minor 3 times in 2 years, revoke their license, no pass and go, no remedy, your license is gone. That is what the industry asked me to put forward. Because if you're going to entrust us with this degree of responsibility, we want to make sure that the executive director, the regulators, everybody has the authority to get the bad actors out. We have demonstrated a number of times with the information from the FDA that we are not the folks selling to minors. We believe strongly in that. So we would ask for your consideration of not just that First Amendment, but there are 4 or 5 other ones. We are willing to work with the committee on this. Most of them, we tried to take what Senator Kramer put together and try to meet that objective as best as we could. So there's a lot in here with explanation about each one. Happy to address any questions, and I thank you for your time this afternoon.
Thank you. Are there any questions? All right, we're going next to Bruce Barriano.
Good afternoon, Madam Chair and members of the Senate Finance Committee. It's always a pleasure to appear before the Senate Finance Committee. Very respectfully, the only good thing about this bill is that Senator Kramer, who I'm very, very fond of, worked with the Comptroller's Office on a piece of legislation. I was very glad to see that. This bill is really all about adults. Very sincerely, the laws are on the books to have increased the age of buying tobacco and vape products. The laws on the books that minors cannot possess, use, sell. All the laws are on the books. So any notion that this book is thrusted towards dealing with minors is misdirected. The fault is that the laws on the books are not being enforced at all, at all. You put more laws on the books, it just won't be enforced either if the focus is on minors. You'll have all the laws you need. What this bill does is it dramatically interferes with the choices and the decisions made by adults and where they can use the product and if they want a flavored product. And that's wrong. Respectfully, they are adults. They're over 21 because you changed the law increasing the age at which you can purchase and use the product and possess it. And we should not be such a rigid state where we're telling adults what they can do and what they can't do. This is not being made an illegal product. It's just been confined to only one place where you can get it. and one place where you can use it. I represent the wholesalers. The wholesalers will be very adversely impacted by this legislation. They have commercial relationships, daily relationships with gas stations, convenience stores, and the wholesalers play a very important role. There's a very major, respectfully, very major wholesaler in Montgomery County, one of the larger employers in Montgomery County. It's going to be very adversely impacted by the passage of this legislation. I would say in closing, let's aggressively enforce the laws on the books dealing with minors as to tobacco and vape products. It's never been done. And please, let's leave the adults alone, whether it's flavored or unflavored, to make their adult choices and live their life. Thank you very much.
Thank you. Are there any questions? All right, if not, we're going to Ellen Valentino.
Thank you and good evening. My name is Ellen Valentino. I'm here today on behalf of the Mid-Atlantic Petroleum Distributors. That's the organization that represents the service station and convenience stores. And I just want to start out by saying that it's good to see you, and I wish I were there. Unfortunately, this is the times in which we have to operate under. But quickly to the bill, this is an unfair bill at an unfair time. And even in the best of times, fairly, I would be here in opposition. So I want you to know that. But during this difficult time and changing economy, I really urge you to take a step back and not move forward on this legislation. It picks winners and losers from a retail perspective. That's what it does. Who can sell vape products and who not? And, the fiscal note doesn't reflect this, but the impact of this bill will be over 7,000 retail establishments, over 7,095 cigarette retail licenses exist today. And I venture to say it would be hard to find one retail establishment that doesn't also trade in vape. So it creates a exclusive path for vape shots. And I know that Isaac Mayer and I have had some conversations. The continued pursuit to eliminate convenience stores from this product availability, we just think would be tremendously unfair. So 3 reasons why not to move forward. It's tremendously impactful. Again, 7,095 cigarette licensees currently are today. I don't want to talk in an absolute, but it would be, I think, hard to find a cigarette licensee that doesn't also trade in vape. And during this difficult time, I think you'd have a full committee room of retailers there telling their story. Again, unfairly creates an exclusive path for vape shops only away from convenience store industry, prohibits convenience stores, service stations, and other retailers from this type of trade in which they've been licensed, regulated, and the products they sell are highly regulated, as opposed to vape shops who still, I think, are what I'm going to call deficiently regulated from the products they mix within their time. So with that said, again, I think we can work together on the goal, and that is underage sales and use. That's something that does bring us all together, but this bill would have a tremendous impact on our industry, and I urge you not to move forward. Thank you.
Thank you. Are there any questions? Okay, we're going next to John Phelps Jr.
Good afternoon. My name is John Phelps Jr., and I'm with Carroll Motor Fuels and Highs. Carroll was founded in 1907, and I'm part of the 4th generation to work in the family business. In 2012, Carroll purchased Highs convenience stores, and today we own and operate 54 stores, 49 of which are in the great state of Maryland. And we employ over 600 people, mostly fellow Marylanders. I'm asking you today to oppose Senate Bill 273. Sales from vapor products has become an important piece of our business. Over the past few years, we have worked hard to reduce our need to sell products with nicotine. But the reality is that these products help keep our stores open and our people employed. As we face yearly challenges from wage increases to decreased demand in motor fuel, any reduction in the types of products we're able to sell hurts. We in our industry have continued to enhance measures to prevent underage sales of restricted products. All our associates go through training on the proper ways to ID customers. Training is conducted on their first day before they even touch the register. And we refresh monthly with every single employee. We continue to invest and upgrade our registers with the most recent and robust age verification technology. We've also implemented independent, unannounced third-party compliance checks. Our goal as a company is to enhance and provide value to the communities we serve. We carefully vet all products and make sure they meet or exceed all standards. When certain vapor flavors were banned last year for us, mango, mint, we don't sell anything other than tobacco flavor and menthol flavor. But when they were banned, we pulled them out of the stores immediately. We have never mixed our own flavors or had vapor smoke blowing contests like some vapor shops did before the FDA started to set guidelines. Our industry has a long history of selling age-restricted products and have a commitment to the communities we operate in to do so responsibly. Taking away our ability to sell vapor devices and eliminating menthol flavored products negatively impact our customers who legally choose to use those products. SB 273 hurts our business, hurts our ability to employ more Marylanders, and hurts our goal to enhance and provide goods and services in our communities, which we've been serving for decades. Thank you.
Thank you. Are there any questions? Senator Kramer?
Yeah, thank you for that, Madam Chair. Ellen, wonderful to see you. Just one quick question. Is it possible that by virtue of the 7,000 cigarette licensees that you referred to that all trade in vape, that maybe we have this epidemic of vaping amongst our children? Is it possible that that's the reason you can't hide, Ellen, turn that camera.
Yeah, I did.
That maybe that's why we have this epidemic. Any correlation there you suspect? And that maybe by not having 7,000 gas stations and cigarette licensees peddling this product just might help us get a handle on this epidemic and getting it out of the hands of our children.
Can I respond, Madam Chairman?
No, I asked you a question.
Oh, yeah,
so
thank you.
Please do.
Peddling, Senator Kramer, that's the one thing I just want to focus. These are legal products as we know it today. And I know that you had the banned products. So, these retailers have been licensed, regulated, and actually been partners in trying to work with law enforcement, the Department of Health over years to curb this sale. So, do I think that right now is the time to strip away and take away and redact a product from a retailer that has historically sold them since the beginning of time that I can remember? I just don't. Well,
Ellen, may I say that this quote unquote partnership with law enforcement seems to have been an abject failure, and that quite frankly, if it was working successfully, we wouldn't be here right now discussing the pandemic of our children being addicted to nicotine through vaping products. So I do appreciate that, but I have to say that partnership hasn't worked out. And I think there comes a point in time when state government needs to step in on behalf of the public health of the community and address it and say, no, this partnership hasn't worked out and we need to figure out a way to minimize.
I appreciate that comment. And if I can retract just the part, 6 years ago, when
I want you to know we're still friends, Ellen.
We're still friends, and you took my call, and I appreciate your recognition that it's hard to find somebody to support the legislation as introduced. But thank you, Madam Chairman. I appreciate coming. I don't think I need to respond further. Thank you.
Thank you. Okay, that's the end of the testimony on that bill. One more. Is it? All right, just a minute. Oh, yes, we've got Jocelyn Collins. I'm sorry. Okay.
Good afternoon, Chair Kelly, Vice Chair Feldman, and members of the Senate Finance Committee. For the record, my name is Jocelyn Collins, and I am the Maryland and DC Government Relations Director for the American Cancer Society Cancer Action Network, better known as ACS-CAN. ACS-CAN stands in strong opposition to Senate Bill 273. The dangers of tobacco do not start and end with electronic smoking devices. As drafted, this legislation is extremely problematic as it encourages product switching by not ending the sale of all flavored tobacco products. Additionally, there's a grave concern around definitions in the legislation on what is classified as a flavored electronic smoking device. There's also concern around the unintended implied state preemption around electronic smoking devices that this bill might cause, and concern on how the bill does not sufficiently address electronic smoking devices within the Clean Indoor Air Act. There's also testimony by the Maryland Legal Resource Center that actually references this as well. We need to be taking a comprehensive approach to tobacco control in Maryland. ACS-CAN is joined by the American Heart Association and American Lung Association, who all support comprehensive policies that will properly address the enforcement and regulation of all flavored tobacco products that include all products and all flavors, including menthol, with no exemptions. We respectfully ask the committee for an unfavorable report of SB 273. Thank you.
Thank you. Are there any questions? Okay, we got one more bill. Is your hand up, Mr. Spencer?
Yep, I'm just going to be real brief, Madam Chair, and just say to my colleagues on this committee, I have never lied to you about anything in the past. I didn't lie to you today. Nobody supports the bill, which means I do think we're on to something here. And for the committee, Madam Chair, thank you. And thanks to all those who came to testify in opposition.
Okay, thank you. And thanks for your testimony. All right, our last bill is Senate Bill 223, Senator Augustine, Plastic Bag Reduction Act.
Thank you, Madam Chair and members of the committee. This is Senator Malcolm Augustine presenting Senate Bill 223, Plastic Bag Reduction Act, and I'm asking for a favorable report. Colleagues, this pre-filed legislation is in the same posture that we passed out of Senate Finance Committee last session, and that which was special ordered on second reader on the floor of the Senate on sine die. Colleagues, timeliness and urgency of this legislation has not changed. Americans throw away 100 billion plastic bags annually. 15 million tons of plastic waste enter our oceans each year, including at our treasure, Ocean City. Every stage of a plastic bag's life cycle emits greenhouse gases. Plastics does not biodegrade. It's a real problem, but folks are doing something about it. 6 counties and/or cities in Maryland have active plastic bag legislation. 10 states currently have or in the implementation process of bag bans or fees to reduce single-use plastic bags and encourage shoppers to bring their own bags. Globally, 76 countries have bag bans across 5 continents. For me, I don't have to go to 76 countries. I can simply go around my neighborhood, which is absolutely littered with plastic bags in the trees, in the storm drains. They are everywhere, littering our community, and we need to take this step to change that. Indeed, what I see when I drive into my neighborhood, the mess that makes me so sick. What drives me on this legislation? As a refresher, the Plastic Bag Reduction Act prohibits stores from distributing single-use plastic carryout bags to customers at the point of sale as of July 1st, 2022. That's it. Simple, straightforward solution to reducing plastic pollution. Specifically, it bans the distribution at the point of sale of plastic carryout bags less than 4 mils to a customer with certain exemptions by the retail establishments. It establishes penalties. It allows for existing local law on this matter enacted as of February 1st, 2021 to remain in effect, after which we will have a statewide standard for carryout bags. With regard to COVID-19, it's really important to note that the only change is the effective date of this ban to July 1, 2020. So that should provide sufficient time for retail establishments to prepare for implementation of the ban. and for us with great hope to have moved beyond the pandemic, understanding that takeout and delivery retail has not been as dramatically impacted versus other sectors of the economy during this pandemic. Now, with regards to the science, what we know is that COVID-19 is a respiratory virus that is transmitted primarily through the air, not on carry-out receptacles. There is no scientifically supported evidence that single-use plastic bags are somehow better with regard to health during the COVID pandemic than a reusable bag or no bag at all, which is what most of us will do in practice. In fact, the virus lives for days on plastic. This has always been about changing our behavior and adopting a more sound practice for our environment and the cleanliness of our neighborhoods. Now, with regard to the shortage of paper bags that could come about, as I mentioned before, we've given plenty of time for folks to get themselves prepared for this. But what we also know is that many jurisdictions, nonprofits, and retailers have provided reusable bags to their customers. Although there is no price floor, which I'm disappointed with, we do allow retailers to charge for or give away the paper bags as they see fit. We were asked for a statewide standard, and this legislation provides that. Earlier today, the chair mentioned looking at the written testimony of a bill, and I urge you to look at the written testimony in support from all over the state, indicating how universal this problem is. 34 in support, 3 unfavorables, 1 information. Queen Anne's, Frederick, Howard, Montgomery County, Prince George's, Baltimore, Anne Arundel, including the faith community. But I would like to highlight this from the written testimony of Waterfront Partnership of Baltimore. Since 2014, when we installed Mr. Trash Wheel, we have removed over 900,000 plastic bags from the Baltimore Harbor. That's on average 10,000 plastic bags a month. Another one that I want to draw you all's attention to is that the Maryland Department of the Environment submitted a letter of information which said, we support the concept of reducing plastic waste and litter and would like to provide additional information regarding the bill. And went on to say, while plastic carryout bags make up a small portion of the overall waste stream, they can pose litter and water quality problems. Plastic carryout bags are susceptible to littering because they are lightweight and they can make their way into storm drains and waterways, posing a risk of ingestion by marine and other wildlife. Finally, I believe in the innovation of our business owners and entrepreneurs who will continue to successfully run their businesses, adapting to the ban while doing right by Marylanders and our environment. For these reasons, colleagues, I ask you for your support to move this forward with a favorable report as we did last session on Senate Bill 223.
Thank you. Are there any questions? Senator Hershey.
Thank you, Madam Chair. Senator, I'm just if you could go over again, because it's a little bit confusing what was introduced last year and what we ended up getting out of committee. At first, it was introduced that there was going to be a tax that was paid for by the consumer at the time of transaction, right? And then we pulled that back. Is that correct?
That is correct. And it was never a tax. What we had was a price floor on the sale of actually the paper or any single-use carryout, and the price was going to be 10 cents. We never would have a tax.
Okay, so who is absorbing that cost under this bill? The cost of the more expensive either plastic or paper bags?
This bill is silent on that, because what this bill does is simply ban these single-use plastics of 0.4 or less, okay? So it will be left to the retailers. And in fact, if you recall, in our committee, there was an ask for just this, which was, hey, why don't you just let our retailers, one of our colleagues who is a retailer himself, let me decide what I want to do. If I want to give it away, let me give it away. Just ban it, okay? Now, if I want to sell it, let me sell it. That's what this now does.
Okay, so a retailer could sell whatever different bag there is rather than the under 4 mil plastic bag, if that's the way that they go.
That is correct.
And if the retailer sells that bag, obviously the retailer would retain whatever revenue is as a result of selling that bag, right? That's
is
not
correct.
it's not a tax. So now go back, and I'm not familiar with every county, and I know there's preemption language here. Do other counties right now have a bag fee or bag tax that would then be preempted by this and then no longer be in effect?
Any enacted legislation as of a couple of days from now, February 1st, will be allowed to continue. So those 6 that I mentioned, which already have, and some of them do have, Montgomery County, I believe, has 5 cents on carry out, that will be allowed to continue. Now, what it will not allow is for, from that day forward, this will be statewide.
So it preempts any new policy at the county level, but existing policies would
grandfathered in.
Or grandfathered in.
Yes.
Okay, good for now. Thank you very much.
Thank you.
Okay, thank you.
Thank you, Madam Chair.
Now we're going to Katie Bremen. And she has 5 minutes. And the rest of your witnesses will have 2.5 minutes each.
5 minutes. I feel very honored. Thank you so much, Chairwoman Kelly, members of the committee. My name is Kate Bremen. I'm an advocate with Environment Maryland, a statewide citizen-based environmental advocacy organization. I just want to thank this committee and really everyone at the Assembly for making this virtual session possible. I know how hard it is to stare at little boxes all day, and I really appreciate you all doing this with issues that are so important to me and to Maryland. So thank you for that. We are proud to support Senate Bill 223 because we believe that nothing we use for 5 minutes should pollute the environment for hundreds of years. Now, I know that you heard this bill last year, so you know the environmental impact of plastic. So what I'd like to take my time to do is to expand upon the urgency that Senator Augustine mentioned. This summer, much of America burned in rampant wildfires. LA hit 121 degrees. Here in Maryland, we're seeing floods, heat waves, and sea level rise. And I know that many of us don't see plastic as a climate issue, but as the senator mentioned, the reality is that from production to disposal, plastic poses a huge threat to our ability to ensure a livable climate for generations to come. From fossil fuel extraction to manufacturing and transportation, to the management of the plastic waste and disposal in landfills and incinerators, plastic production and use contributes hugely to our overall emissions. Studies show that the production and incineration of plastic this year alone will produce more than 850 million metric tons of greenhouse gases. So that's equal to the emission of 189 new coal power plants. Now, I'm not telling you anything I haven't told you before, that plastic production relies on fossil fuels. And due to the boom of cheap fracked gas and crude oil, plastic production is projected to increase astronomically. Now, here in Maryland, we've set progressive goals to move away from fossil fuels. We were the first state to ban fracking. So our reliance on single-use plastics that are produced using these fuels really stands in stark opposition to our goals. And here's the thing, plastic bags are not a necessity. The fight for a livable planet looms larger every single day. And in addition to that fight, our fight to reduce microplastics being consumed by wildlife and that we are consuming as well also looms larger. New research has found that humans are consuming a credit card's worth of microplastics every single week. And what researchers are finding is that as that microplastic comes into our body and gets smaller and smaller, it can get into our lungs, it can get into our bloodstream and actually fight with molecules in our bloodstream. So I urge you to take this simple, swift action to help us fight not only for climate, for water, for wildlife, for air, but also for our own public health. Before the pandemic, Environment Maryland staff knocked on doors across the state and had more than 15,000 conversations with Marylanders about plastic pollution and banning plastic bags. And the feedback was clear. It's time to kick our plastic habit. We know better about plastic waste. We know it's harming our air, our water, our wildlife, our health, our climate. And we have an opportunity today to do better in making one very simple change. I urge you to vote favorably on this bill, and I am happy to answer any questions you might have. Thank you so much for your time.
You are a great presenter. Could I ask, what are one or two of your major sources, your research sources? You gave us so many very interesting statistics that are impressive.
Oh, absolutely. And I was an elementary school teacher before this role. So if you've heard of all the teachers on Zoom, I think that's where it comes from. So some of our biggest resources for information has been NOAA's marine debris research. So that's the National Oceanic and Atmospheric Administration. They have done some phenomenal research on plastic pollution in our water and our wildlife. We also, Environment Maryland has a sister organization that is a research group that has done a lot of research on plastic pollution and recycling rates. The health information I gave that I mentioned, the getting into our bodies, that comes from Dr. Ben Lachlan, who is an epidemiologist who actually specializes in transmission of viruses, including COVID-19. And so that research comes from him and his colleagues. All of that I can easily send if folks want to read through those reports. I'm happy to send those over.
Okay, thank you. Thanks a lot. Are there other questions? Okay, thank you very much. We're going next to Alexandra Desard.
Hi, can you hear me?
Yes.
Okay. So my name is Ali Dysard, and on behalf of Moms Organic Market, I'd like to express our support for the statewide plastic bag ban. I'm the environmental manager at Moms, but I'm also on the board for Trash Free Maryland. 1 million plastic bags are used each minute. As a grocery store, we at Moms know there are many alternatives to using plastic bags. We banned plastic bags 16 years ago in 2005 from all of our stores, and we moved to providing only paper bags and compostable bags. At Moms, we offer customers a 10-cent incentive to bring in their own bags from home, reusables. Company-wide, our customers now bring in over 7,500 reusable bags every day. That's about 3 million bags per year. So this shows us that incentivizing good, sustainable, habitual behavior truly works. This year, we will open our 21st store. So making the switch to a positive environmental practice 16 years ago in no way impeded our growth as a business. Why are plastic bags so bad? The average amount of time most plastic bags are used is less than 12 minutes. They are just a carrying agent to transport one item from one location to another. There's absolutely no reason to provide a customer something they will use for a few minutes that will still be here littering the planet in 500 years. COVID has been brought up a few times, so I just want to kind of touch on that. Plastic bags actually carry the COVID virus longer than reusables and longer than paper. We've done that through our research. We allowed reusable bags to be brought into our store. The customers just bagged them themselves, and it was not a problem. Some people might think, but aren't plastic bags recyclable? They are not. As a company with a very extensive recycling program, we at Moms were not able to find any companies interested in taking plastic bags for recycling. Somebody may bring up Trex, the decking company, but you have to compile 40,000 pounds of plastic bags. You have to bale them. They have to be pristine. They have to be clean. They have to be dry. You have to store them. They can't be in the sun. They have to be indoors. And that'll take, I don't know, anywhere from 3 to 4 months to compile 40,000 pounds of plastic bags to then see if Trex wants them. If Trex doesn't want them, then they just get incinerated or burned locally. There's no market for plastic bag recycling. There's not locally, not regionally, and not abroad. There's also no public works department in the state of Maryland. There's no Maryland County or curbside recycling program that allows plastic bags for recycling. So if it can't biodegrade and it can't be recycled locally or at all, then it just needs to be banned. Thank you for your time and attention on this matter. You have the opportunity to be leaders on this issue, and I urge you, we at Moms and all of our customers, urge a favorable vote on Senate Bill 223. Thank you.
Thank you. Are there any questions? All right. Who?
Dan, next one, he's not in.
Okay. Okay. We're going next to Linda Boyd.
Good afternoon, Madam Chair, members of the Finance Committee. I know you have had a long day, so I will keep my comments short. I'm here on behalf of the Episcopal Diocese of Maryland. We have parishioners and churches that span from Western Maryland to Southern Maryland. And I'm here because on a slightly different slant, we believe that God created this world and us in love, and God entrusted us to treasure and care for God's creation. Banning plastic bags would be a major step toward that goal. It would be doing what God has asked us to do to make sure that we are improving the climate for our children and future generations. Thank you so much for giving me time today to testify. Are there any questions?
Okay, are there? Well, thank you for testifying.
Thank you.
We're going next to Zachary Taylor. Now, we've got the three last that are unfavorable.
Good evening, Madam Chair, members of the committee. Thank you so much for the time this afternoon to talk about this. I am the director of the American Recycled Plastic Bag Alliance. We represent the U.S. manufacturers and recyclers of plastic bags, including operations right in Howard County in Maryland. Our thoughts on this bill are simple. Given the ongoing pandemic and the economic uncertainty that will follow, we urge the committee to consider pressing pause on this effort and evaluate other policies adopted by jurisdictions across the state of Maryland and the region that might be able to meet the sustainability goals at the heart of this effort without creating unnecessary challenges for communities and small businesses that have been suffering as a result of COVID-19. We stand ready to work with you and evaluate alternatives that would achieve those goals. I want to note, several weeks ago, the city of Baltimore chose to delay implementation of its bag ban for just 6 months, but reserved the right to extend that delay. Many other jurisdictions took the same approach. Here's why. City Council President Mosby lays it out pretty clearly. Why they're delaying it? Not in the midst of this crisis, where it would bring the greatest burden to our neighbors who are already fighting to meet even basic needs. As a result of COVID-19 restrictions, obviously we've seen increased grocery shopping, delivery, and restaurant takeout. Demand for bags is rising. These trends are exacerbating a national shortage for paper bags, which the industry suggests may last for years, as many as 5 if additional manufacturing capability comes online. At the same time, feedstock for reusable bags, which are also made out of plastic, mostly polypropylene, have been diverted to PPE production. So there's creating additional challenges there for businesses desperate to find bags they can offer their customers. Costs for alternative bags will continue to go up, and as a result, consumers are likely to see higher prices for products, or bags themselves. Worse, for smaller businesses who cannot absorb these costs, they may have nothing to offer consumers who enter their stores. While we certainly recognize the importance of sustainability and support efforts to promote a more circular economy, this policy were to move forward, Maryland risks imposing a costly burden on vulnerable communities and the small businesses that serve them at a time when many will likely still be trying to recover from the economic fallout of the pandemic, even in July of 2022. Given the uncertainty around the timing of the recovery, we respectfully urge the committee to consider revising this ban and looking to other policy that has been implemented in the state of Maryland that can still, as we've heard from others, change consumer behavior without necessarily unleashing these burdens on communities that are still struggling. Thank you very much. I'm happy to answer any questions from any members of the committee.
Are there any questions? Let me just butt in then before we continue. I'm looking at the fiscal note, which is written by lawyers who know how to keep their personal opinions out of things and to take a look at the data and to see what they show as impact. And they say that the ban on providing plastic carryout bags does not take effect until July 1, 2022. So it's assumed that retail establishments have adequate time to use existing inventory. I don't know if that helps at all for those of you who are concerned about immediate impact on or hard hit businesses at the moment. Are there questions from anyone else? Senator Klossmeyer. You got to unmute.
Zachary, are you still there? There you are.
Yes, Senator. Hi.
What about the storage of paper bags if you have to go to paper bags? Can you compare 1,000 plastic bags to 1,000 paper bags?
So certainly happy to answer that question. I think this goes to something that was noted earlier as it relates to emissions. To transport one load of plastic bags takes essentially one truck. To transport the same number of paper bags would take 6 or more, depending on size and availability. So you have to consider the additional impacts of those emissions as well. And that's what many government entities have done. After life cycle assessment after life cycle assessment has found that when you look at the total picture, as long as they're disposed of properly, plastic carryout bags have among the fewest environmental impacts. And we think that this policy would eliminate some flexibility for small businesses who don't know who we can't say where we'll be in 2022. Thank you very much.
Okay. Okay. Thank you.
All right, we're going next. All right, we're going next to Kelly Locklear.
Madam Chair, honorable members of the committee, for the record, Kaylee Locklear here on behalf of the Maryland Retailers Association in opposition to this legislation. We submitted written, I go into more detail, I'll try to be brief, but as we discussed with the committee last year, our organization cannot support this legislation without a price floor and without true statewide preemption. This has been, and the sponsor used the word, I'm going to use it too, really disappointing for us. But I want to thank him and the advocates for years of work on this legislation. That price floor provides a level playing field on paper to help cover just some of the cost for as many retailers as possible. And additionally, last year we discussed, and you've heard a little bit about it today, the paper bag shortage, which truly did come to fruition as we said it would. Coupled with paper bag plant closures with COVID, numerous states and localities had to allow plastic bag usage and paper bags as paper bags became unavailable. Finally, health concerns from the pandemic also altered the course of bag laws. You heard about Baltimore City, but there are actually 3 states that ended up having to delay the implementation of their legislation, as an example. Most store employees will not handle reusable bags in the current climate, and that's either due to store policies or their own health concerns. Grocery unions had publicly asked for temporary returns to plastic during the pandemic as well. And I'll also just mention in our stores, a common complaint by consumers that we've heard has been a consumer not even wanting their food to touch an area someone's reusable bag has been because they don't know where it's been. So that's just been interesting for us to handle in grocery. So with these comments in mind, we urge an unfavorable report. I am more than glad to work with the committee and implore you to consider revisiting the price floor and again, one law in our state. Thank you.
Thank you. Kaylee, what right now would be the difference in operationally to a business that moved from a plastic bag to a paper bag? And if bills like this were implemented, we wouldn't have the shortage of the paper bags because that's what people would create, wouldn't you say?
Absolutely. New York, there's a big battle there. Zach can certainly speak to a lot of that, but that caused a massive shortage. We knew when New York came online, which was in October of last year, it was going to cause a problem. And I'm so sorry to do this, but this is what I showed you last year. For smaller retailers, this is the price that we're talking about for just a small gift bag. For a larger bag, and you can look this up, I gave this to you last year, these are the price differences that we're talking about. So 10 cents in no way covers the cost of these bags. And that's why there needs to be some type of floor to help these little small retailers that you're talking about.
Let me ask you this. If we make the change and it is a timely change, and maybe we need to extend that deadline a little beyond the July 2022 because we might still be in the pandemic. Once you have a real market for something like paper bags, so many more of them would be in use, it's going to be cheaper to manufacture and to stock. Wouldn't you agree?
They're not easy to stock. And you heard a little bit about that. There's a huge difference between plastic and paper. And Zach can definitely speak to that. But you heard the example of one trailer of the same amount of plastic bags and 6 trailers of paper bags. So as far as how large the product is, and it can be very difficult for a small retailer. We talked about this, I think, at length before. So it is a
So
challenge.
let's agree that to do it immediately would be a problem. To do it when there isn't enough demand for the paper is going to make it more expensive. But if we were to delay to a sufficient point and get out of the pandemic, probably it would be cheaper at that point in time. But when we talk about costs, the cost of having to go into the Chesapeake Bay and get that plastic out so the fish don't swallow it,
Right.
The cost of having it jam up people's pipes, the cost of it being around for maybe millions of years, those costs are still there, aren't they?
And we understand those environmental arguments completely. However, we have traditionally pushed, instead of bans, recycling programs or ways that we can figure out how to actually reduce and reuse items instead of outright banning them. Because arguably paper isn't better. And I just want to throw this out here to the committee as well. New Jersey, for the record, banned both plastic and paper because of the problems with paper supply and how much paper costs. So I'll mention that to the committee as well. Say what?
What do they go to instead?
It's reusable bags only there now. So they went ahead and banned everything because
Madam Chair, if I might, just two quick points related to your question, if that's all right with you. First on the paper bag.
I'm sorry.
I'm going to ask that you not interfere. You had your turn.
Absolutely, ma'am. My apologies.
Happy if anybody, and a lot of you have expertise, were to send us back an answer. We're just trying to finish with this later witness. But
my apologies.
You tell us, we want to know it. I'm going to shut up with my line of questioning. Anybody have any other questions? Yeah, who is that? Senator Hershey.
Thank you, Madam Chair. For Kaylee, again, if I could, you had mentioned that a number of these larger retailers, I guess, have the capability of potentially moving to the more expensive paper bags and could probably absorb those costs. I would also assume that the larger companies could probably buy on volume to help drive down the cost of paper. I would think that something like this would put the smaller retailers at a somewhat of a competitive disadvantage, that either their costs will be higher or they would be forced to pass those costs along to the customers. Have you heard anything about that, or could you elaborate on that?
This was a part of our arguments last year with Senator Augustine when we were on team pass the bill with the floor. It creates a level playing field. Otherwise, you have a outright competitive disadvantage to what you just talked about. A larger company will be able to eat that cost. And when a consumer looks at where they want to shop, they are going to think about, well, I don't want to have to pay 50 cents for a bag or 10 cents for a bag or whatever it is. I want to go to the store that gives me the bag for free. And so it's going to put the little guys at a competitive disadvantage.
Okay. And one more question, because it was mentioned about delivery services. Obviously, we've seen a lot of that with the pandemic, people not going out as much. You know, I'll be honest, it's a little bit easier to carry 6 or 7 plastic bags all kind of bundled up through the straps and be able to move, carry things around. I mean, paper bags, I guess the ones that you show, are not just the paper sacks that we're used to seeing before, but these would have to have handles in them that are strong enough to be able to carry what does the grocery service delivery model look like without plastic bags?
It is difficult for delivery, to say the very least, and this bill does ban those bags to be able to be used in delivery. And I'd probably ask everybody on the committee, any of you that have ever used a paper bag with handles, tell me how that went. Like, I don't care if you have the tiniest item in there, they break. So those handles really don't help consumers in any way. They're kind of for show, I suppose. But yeah, you're absolutely correct. It presents problems in delivery, and more people than ever are having their items delivered.
Relying on that. Okay. Thank you very much. And thank you, Madam Chair.
So let me just ask you this, Kelly. So if the sponsor were willing and the committee were willing and the General Assembly were willing to delay further, let's say to January 1, 2023 or 24 to make sure we're out of the pandemic mode, would that make a difference to your industry?
It's those two areas why we can't support it, but I will say this came up on the House side as well. So if there's additional language that goes in the bill that says post however long you think appropriate outside the pandemic for particularly, I think, medium or smaller businesses to recover more, I think that that would be absolutely appropriate.
Thank you. Are there other questions? Senator Bottle.
Thank you, Madam Chair. Kelly, it's nice to see you again. I may be one of the few people here that's ever worked in a grocery store, but for many years I worked at Giant Food and we used paper bags, and the food stacked in it really well when you learned how to square up your bag. When I get groceries now and I use plastic now because I'm not taking my reusables into the store with COVID, I end up with 5 or 6 or 7 plastic bags to what would have fit in one paper bag. And back in the day, you didn't have handles on those paper bags. You had paper bags that you just simply picked up from the bottom and put in your car. I shop at Aldi's, no bags. I shop at Costco, no bags. I shop at BJ's, no bags. It all works out. So, you know, I think I have a real concern about the plastic bags. As our senator said, they're hanging in the trees. They're just littering our area. And I just think we need to find a solution. But thank you for sharing your testimony today.
All right. Are there any further questions? Senator Augustine.
Yeah, thank you, Chair Kelly. And we're late in the day and I don't want to extend this any longer. Senator Bidle hit the nail exactly on the head. We just got to change this behavior. These plastic bags have not been around forever. We can surely do without them and do better by our environment. So I just wanted, that was going to be where I was going. So thank you, Senator Bidle. I appreciate that.
All right. Thank you very much, all of you. And that, do I have another? Oh, did Melvin Thompson ever arrive? Mm-hmm. Okay, he's here now. Okay, Melvin.
Thank you very much, Madam Chair. Members of the committee, I'm Melvin Thompson. I represent the Restaurant Association of Maryland, and we are opposed to this legislation. A lot of our restaurants use both paper and plastic bags to suit their needs. If it's a sandwich, it might go in a paper bag. But if it's a food item that's prone to leaking or soup or saucy things, a plastic bag is a leak-proof barrier that restaurants use to meet that need. And we believe that restaurants should be able to continue to do so because the paper bags do cost significantly more than the plastic bags, and it is very difficult for smaller restaurants with lower menu prices to absorb that cost. And you might see paper bags used in more expensive restaurants that have higher menu prices because they can absorb that cost. But when you're dealing with a lower menu price, it's very difficult for the business. And it's also difficult to pass that cost on to the customer because customers are very price sensitive these days. And we believe that this legislation will also add an additional cost burden onto our industry as we try to recover from the devastating impact of COVID. And so for those reasons, we oppose this legislation and request an unfavorable report. Thank you.
Would it matter to your industry if there were a delay sufficient to go beyond the pandemic?
Well, the uncertainty for our industry right now, Senator, is that we don't know when business will return to pre-pandemic levels. There are a lot of experienced operators who believe that it could take up to 5 years to return to pre-pandemic levels and for them to fully recover because of the amount of debt that they've incurred trying to keep their businesses afloat. And so we would prefer this year that the General Assembly hold off on passing any bans or mandates that would increase the cost of operations to restaurant businesses.
Okay, we hear you. Okay, any other questions? All right, Well, that ends the testimony on Senate Bill 223, and it is our last bill for the day. As I said earlier, I want to remind you that starting next week, we will be on Thursdays taking a half-hour break after our hearings, so we've got a decent amount of time to do voting. Tomorrow, we will do the short voting, which can't be more than 45 minutes, but we don't have a lot right now. And so we can get to the floor for the 1 o'clock, for the 12 o'clock voting floor session. Okay. Thank you, colleagues. Everybody hung in there. We've heard some interesting bills today and hope you have a good evening.